Optometry. We did a study in first episode psychosis, and we found if we measured the malondialdehyde by HPLC, there was a significant decrease. Whereas if we measured it by thiobarbituric acid, UV spectrophotometry, there was no inter-individual variation. So there was a threefold increase in the amount of T-bars by UV spectrophotometry relative to malondialdehyde. And we lost the significant difference because the acid is not selective. So I would, to my dying day, say, if you're using T-bars, if you're using UV spectrophotometry, your paper should not be published. You're not measuring malondialdehyde.
It's surprising to me.
Read the paper.
Many papers, they use that to measure your level of
Yep.
in the brain.
Yep, and
This is my fourth time of.
it's not. There are many papers, and that is the problem. The referees are letting these papers go unchallenged. It has been known for 30 years that thiobarbituric acid, as a measure of malondialdehyde, is not specific. Okay.
Hi, Suzanne. This is the last question from Kaushik.
Yep.
Yeah, I think quality control and quality assurance is very important. But like scientific evidence, where is the scientific evidence? We have seen Cochrane reviews and there is no scientific evidence. So what is your view? Because MHRA, EU guidelines, they need scientific evidence.
Do you mean scientific evidence of the efficacy of herbal medicine?
Efficacy, yeah.
It's a very personal question, isn't it? I personally don't use herbal medicines. My first PhD and I think because I understand very clearly the potential for drug interactions and complications, I won't use herbal medicines when I can use conventional pharmaceutical compounds, just because that the interactions are not so well defined. That's my personal. But other people would say, well, these pharmaceuticals are not safe and they're not natural, and that's their choice. And if we can allow people to choose to smoke and to eat to excess, we can allow them to choose to use herbal medicines, but we have to help them do it in a safe way, because there is the legislative need for that.
I think both these things are very important. Quality assurance as well as randomized controlled trials, clinical evidence for these medicines. Yeah.
It's the funding for the trials. They're so expensive.
Yeah.
Okay, thank you very much.
Thank you, Dr. Sudhan. It was indeed a very interesting presentation. Please collect your certificate.
ना अरे ना
For our next presentation, we have Dr. Nitin Chaubey from Ayurveda Varsha Clinics and Ayurveda Health Cafe, India, and his title of presentation is Management of Oedema and Swelling using a combination of Haritra, Pineapple Stem and Shalaki. Please welcome him.
Okay. Okay.
Good morning and greetings to the chair and also to all the fellow participants here. The August gathering. Just before I embark on this presentation, I would like to brief myself and also apologize that this might just stretch a bit on time, but I would like to go through it. And I'm privately practicing medical practitioner. I'm an Ayurvedic doctor and associated with a public sector undertaking Coal India on an ad hoc assignment. This is basically a set of clinical observations that I have made, and it proposes a lot on the possible mechanisms and ways this combination would work in terms of Ayurveda. It may have certain components which a lot of you may not understand, being on the traditional side of Ayurveda, for which I would request that we could probably talk anytime beyond. When I start with it, I would like to state, and this is the first thing that comes across, mostly and this is not alone for Ayurvedic doctors, this is for everybody, every medical practitioner, that edema or post-traumatic swelling, this is something we encounter, and this is a very paradoxical question, especially if it comes across after a duration of trauma, because it needs to be differentiated if it is a metabolic syndrome or due to a metabolic cause or due to some infective and traumatic cause. Now, what it says is that Ayurvedic view of swelling is primarily Pittaj with a Kapha coexistence, and in a freshly induced injury, it has always resulted because of a vitiated Agni and Vayu Mahabhuts. Now, when I say that, this is representative of the fact that in a fresh injury, you always find heat and rubor at the site of injury or the infection. Infection, why I bring it in here is because I would treat it as a trauma from inside due to an infective cause, and an external injury is of course an external injury. Now, once this state goes on, once that picture goes on, it changes from red to blue to black, and that change signifies the dominance of Kapha or the change of character towards Kapha and the alleviation of Pitta in time. Further, this is what I have worked on, that is a traumatized tissue with this combination, how it works along, and this is what I am going to take through in the further course of slides. Now, the material here that I have used are standardized extracts that are already available in the market. Bromelain is pineapple stem extract. Boswellic acid is an extract derived from shallaki, which is conventionally used in rheumatoid arthritis and other conditions associated with arthritis. And curcumin, conventionally used form haldi in various conditions ranging from fever to cancer. That is where I make stand on it. Now, this is a continuing set of observations. Even till now, I have people who are going through it and I am using it. So, I will be documenting it. I will be further improvising on this in the due course of time. Today, when I look at it, I will not be talking of the modern view on bromelain because everybody knows about it. What in the Ayurvedic context I would say is bromelain is known to be a set of enzymes. So, it has a catabolic character. Now, when I look in that sense, in the Ayurvedic sense, it has been an enzymatic property which has to do with a Pitta and Vata function. Because this has a lyasing character, it would lyse, it would cut down, it would break down the biomolecules there where it is acting. And the anti-edematic property may likely be due to the nature of chemical bonding and covalent character of carbon chain and nitrogen in the context of proteins. Going further, in case of boswellic acid would present this complex group of chemicals in an amla form or an acid, as we call it. And an acid would have a different form of action. It is Pittaj in function because it has a inherent character of producing heat. The pathway of action of these molecular substrates is likely to be classically similar to traditional enzymatic activity of catabolism. Reason why it reduces stiffness is due to the reason likely model of acid and base reaction. Hence, it may induce some formation of gel at the local site, which assists lubrication properties of shallaki, and at the same time, it may also therefore reduce the heat component associated with arthritis. Now, gel here does not specifically mean water. It just specifically means a lubricated character that is induced because of the action of the drug or the components there. Further down, if I go to curcumin has, we all know, antioxidant properties, and it acts as a double-edged sword. Like most antioxidants, it is known primarily to be anti-inflammatory, antioxidant, chemoprotective, and chemotherapeutic. In the Ayurvedic context, curcumin may be understood to have a Pitta property again, and that is symbolic of its color and also the actions that it brings about. Normally, it causes a warmth of a feeling. This may be a reason for its anti-inflammatory properties coupled with its antipyretic properties, and that is because it is again a lipid derivative and it can be emulsified. When I say emulsified, curcuminoids may bind with the cell membrane. Because cell membrane is lipoproteinous, and that gives an affiliative environment for any such molecules to associate with them. Coming down to mechanism of actions, I'll not go through the modern part. This is what I believe, that the muscle cell environment is a lipoproteinous environment that we all know. And going forward, what happens is when there is trauma, signifies VA, that is traumatic condition, and in a post-traumatic lipoproteinous environment, there is always in the first stage Pitta, Agni, Vata, Jal and Akash, all the 5 Mahabhuts being impacted. But when it further goes down, combining with Prithvi to create a stiff, Prithvi is supposed to be this solid character or the solidity symbolized. Now, after a trauma, we always find that there is stiffness associated at the site. So that comes in, and in the post-traumatic phase, that slowly gets changed and comes to a state where Prithvi gets reduced, and with it, Agni is replaced with Jal, and that brings about edema in the site of lesion. Further, when we treat it with bromelain, bromelain has its own properties which are primarily Pitta, Agni and Vata predominant. When these combine into the environment, the environment changes through 2 stages. And in the first stage, we see that all the 5 Mahabhuts are there, and further down it again goes through a replacement cycle in the first place where Jal is replaced, and finally we come down to the muscle character where it is primarily Pitta, Agni and Akash. Akash, why I say, is because most of the muscles have a space, muscle cells have a space in between them, and that space provides for a lot of relaxation and aggressive action or proliferative characters of the muscle cells when they are hyperactive. In summary, this is how I would like to represent it. Further down, if I look at similar character, but here the action is more quick. It doesn't go through different stages. And what it does is phosphoric acid being rich in Agni, Jal and Vaya Mahabhuts, it's just translating it across into a small zone of a stiffened muscle which is further relaxed due to a self-absorption. Now in case of phosphoric acid, what happens is the gel or this component of gel and Vata together is reabsorbed into the body, whereas probably in case of bromelain, what happens is it gets reabsorbed into the blood system and is taken off via the circulatory system. So these are 2 likely mechanisms of different actions at the same time. If I look at curcumin, it has a similar character, but when curcumin combines, essentially there is heat release. Also, in the later course, heat accompanies sweat. Heat accompanies sweat, and that is where water is removed. So in tandem, if we look at it, and I'll be going back to when I talk of synergies, the fact that bromelain is reabsorbing water, that is edema, through a circulatory channel. Phosphoric acid is reabsorbing it into the tissue because the water component released there is very minimal. In case of curcumin, it is coming out via the skin. So the action why I believe this component has worked across the clinical reasons, and I'll be coming to that post this slide, is because of the fact that the water elimination, which is the primary of edema treatment, is happening through 3 different mechanisms at the same time. What's happening here in the post-traumatic environment, all these 3 are combining together but functioning in a mechanism which is independent to them. So the synergy is independent, the synergy is limited to action as the final outcome, but they are not interacting amongst them. This is what I believe. This has to be corroborated. Any tracer mechanisms, etc., that is possible in a laboratory. This is not possible in a clinic. These are clinical observations. But the impact that it brings through is representative of the spectrum that I have used it. That is allergic rhinitis, arthritis, rheumatoid arthritis, hemorrhoids even till the grade 3. Then traumatic injuries, pyometra, diabetic foot, and lately I'm also using it for squamous cell lung carcinoma. I can relate to this particular case of squamous cell lung carcinoma, which has been the dearest to me and I'm pursuing on it, is when this patient came up to me, that was in July this year. She was in a state where she had been told that she would not live more than 10 days. And at that time she was having to go through tapping for say every week, and the volume was about 3 to 5 liters of the fluid being drained. But post September she had the first drainage a couple of weeks back, and that was only 250 ml. So coming till September and September till now, across 2.5 months, if that has come down, besides the anti-cancer medicine that I'm using, and that's Ayurvedic again, I didn't ask her to stop the modern medicine. She has stopped on her own. That's a different aspect. But probably the reduction in the edema component, probably the reason why the fluid has gone down is to this fact. And this factor is what I'll always attribute to. Though I'm still studying it, I'm still observing it. This still goes on till the patient is alive, and I'll be observing it. If I go through a bit of detail of my clinical assessments, allergic rhinitis, I have seen changes within the first week, especially for the factor of congestion that patients complained with in case of even bronchial asthma, and these were about 28 patients. Arthritis, across rheumatoid arthritis, the spectrum, it has been a total of 77 patients, the maximum number that it has been exposed to, and while stiffness has gone reduced in and swelling in the first week itself, edema has slowly taken time and has shown results across 15 days of time. Similarly, in a controlled state for rheumatoid arthritis, I don't see the data here for hemorrhoids and squamous cell carcinoma having come up, but those I have already shared with you. The only thing I can say towards the conclusion of this is that on the basis of the likely models, and these are likely models and clinical table posted above, it is of significance to note that as an adjuvant, it is an effective combination in the management of edema. It has potent anti-inflammatory properties. The likely models of activities and their synergies present with a wide range of possibilities as in trauma or trauma-like conditions which may be induced for varied reasons as disease-related infections, autoimmune reactions and associated inflammations, age-related degradations as in osteoarthritis and related inflammation, in conditions like allergic rhinitis and psoriasis, which have a genetic or immune disposition as a result may represent a cross-infected state accompanying in pain, inflammation, edema, as in either of the conditions or all of them together is a complexity. Hence, it may be used variably across a wide range platform as a primary medication for supportive and also parallel therapies. Thank you.
Thank you, sir, for the presentation, sir. I'm just wondering the content of the combination. I need the proportions
Okay.
of the three components. That is number one, sir.
Okay.
The second one, I want to suggest, sir, whether this combination might be useful in hydrocephalic brain of patients. Maybe you could also look at that. It's a very serious condition that involves serious kind of surgery that always end up as failure. But perhaps this compound may be helpful in such patients. Thank you.
Okay. As far as the content is concerned, bromelain is 125 mg per dose, curcumin is 500 mg per dose, and boswellic acid is 250 mg per dose, and can be given to the extent of thrice daily. Normally, as far as bronchial asthma and allergic rhinitis is concerned, it can be used, it's enough to use twice. But for conditions like severe edema induced due to trauma, it is thrice daily. For case of cancer, it may be used QID as well. But I have not used it at a QID level, so I would not talk about it. TID is I have used, thrice you can. As far as hydrocephalus is concerned, you're right, and this compound does come in place between pre-surgery and surgery. It may have a role. but I am yet to come across a case of hydrocephalus around me to be able to use it. So I cannot say whether it will be effective or not, but it may have, because it does go through and enable drainage across various shunts and various possible routes, as you would know. Sure.
Since you mentioned the doses, this question comes to mind.
Sure.
What is the toxicity of this combination? Because it comes to around 900 mg of, including all three, per day. And how long is there any toxicity data on this combination?
I have not evaluated it personally in the lab, but
bromelain
is not known to be toxic at any age is at all. It has been used even in children below 2 years. There are formulations already existing. Boswellic acid we normally do not advocate to children below the age of 7. Even in Ayurvedic parlance, we tend to use our combinations as Yograj Gugul for that, but we would prefer not to use boswellic acid because the environment of the gut is not yet developed to support the post hyperacidic conditions that are induced by boswellic acid. And curcumin again, we hardly know of toxicity unless, of course, it is coming from a source which has a toxic soil content.
Any side effects for this combination?
I have not come across. The only side effect, if at all, is a bit of hyperacidity, for which conventionally I use milk as an accompaniment to take care of.
Any more queries?
Thank you.
Thank you, Dr. Nitesh. Thank you very much for a very nice presentation. We are breaking for a coffee break, and we'll be back sharp at 11:45 for the next session. I request Dr. Sharmila and Dr. Marja to present Dr. Nitin with a certificate. A round of applause, please.
Okay.
After coffee session, we have presentations from Dr. Sharmila and Dr. Marta as well. Thank you very much, and we'll see each other at 11:45. For announcement, I request Dr. Jules Clement We are resuming the session post the coffee break. I hope you all have enjoyed your coffee well and cookies as well. So, for our first presentation post coffee break, we have Dr. Sharmila for her presentation. Dr. Sharmila, we welcome you for your presentation. Please give her a round of applause.
Good afternoon, everybody. Thank you very much for giving me the opportunity to discuss the work going on in my lab. And I shall try to keep the time, and I will request all my followers to keep the time because so everyone can get time. If anyone has any discussion, then I would request to have the discussion during lunch. I will discuss a part of the work of my lab. That is, we are working on traditional medicinal plants for a long time, and the major objective is this to the scientific validation of traditionally used medicinal plants of India. You all know that Nectanthus arbotratis, this is a traditional Indian medicinal plants commonly known as Shuli or Shefali in Indian languages and in night jasmine in English. So this is used for last 100 years or I don't know, it's time immemorial. We can see its name in all our traditional medicinal Indian medicinal books, and I think not only in India, throughout the world it has a use. So after getting the job in CSIR laboratory, I thought maybe I can start this scientific validation using the CSIR facilities. As you know that in India, CSIR has really good facilities. So I did my PhD in medicinal plants as well, but that is on Mucuna pruriens. So the a view why we are interested, because we want to develop an inexpensive herbal source for the underprivileged section of the society. That was the objective of my work, as well as through the scientific validation of the traditionally used medicinal plants. So for that, we all know that India is endowed with an enviable wealth of medicinal plants, because still a huge section of people using regularly in their regular life the herbal products, because they can't afford the so-called high-priced allopathic medicine. And there are I don't want to debate on the point that what are the plus points for herbal medicines and what are the minus points, because we all, and the present investigation has been designed for the identification of potential herbal agent against visceral leishmaniasis from some useful medicinal plants. We have done screening of so many times against visceral leishmaniasis, but today I will discuss only the result we got from night testing. Before going to discuss in details of the work on that, I must say something about visceral leishmaniasis. This is known as Kala-Azar. This is predominant in a certain part of India, and if it is not cured in time, it is fatal, and it is prevalent in Bangladesh also, and it has different, it came back, it recurs very frequently. So, and the medicines, that is quite expensive, which can cure completely, and the other medicines which is using for last 50 years, now the sodium stevogluconate, people are becoming resistant against that. So it needs attention. This particular work, mostly happening with the poorest section of the society, needs an inexpensive source so that they can be treated. Keeping in this mind, I started to work, and the Shivli, that night jasmine, in Bengali and Hindi it is known as Shivli or Shefali. It is growing throughout India, in every parts of India. So we have collected plant from a particular region to avoid the geographical variation, and we did the selected parts, that is the leaf of the plant was shade dried at room temperature and then ground to coarse powder with mechanical grinder, and then extracted with 50% aqueous methanol extract with aqueous methanol for 3 times, and those combined extract then evaporated to under reduced pressure below 37 degree in a rotary evaporator, and that dry powder was initially used against axonic chromasticwood culture of causing agent, that is Leishmania donovani. That is the causing agent of visceral leishmaniasis. And these are some other work, but today I will discuss on night jasmine. That is, the scientific name of the plant is Nyctanthus arbotratis, and the traditional use reported till date is anthelmintic, and the edible source of beta principles. It is even used as edible source of beta principle for last several years, decades, I mean more than 100 years in Indian subcontinent. So regarding the cytotoxicity and all these things, I don't think so there will be any problem. So today I will focus my work, I have focused my work on anti-leishmanial activity, and for that we have done the bioactivity guided fractionation of the 50% aqueous methanolic extract, and then the compounds are also isolated. We have done patent on that, and Leishmania donovani, we have done the testing against the L. donovani infected golden hamster. That is the established model for visceral leishmaniasis. And we have isolated many compounds, but this alkyloside A from the methanolic extract, which has given a really good activity, which has been, we have tested against the L. donovani infected golden hamster, and published this paper and did the patent as well. So this is the IC50 values of crude extract. That is the crude extract. It is the 50% ethanol extract. P is the bioactive fraction. After doing the bioactivity guided fractionation, this is the N-butanol fraction. And then the compound we got through the column chromatography. These two are the compounds. You can see we can get a IC50 of Cali is good. And amphotericin B, the standard drug against visceral leishmaniasis, was used as a standard compound to see our activity.
And to see the mechanism of action, how this Kale is working, we have done some antioxidant profiling, because antioxidant in high dose working as a pro-oxidant to kill the L-donophony. It is reported from other plants, so in other studies. So we did antioxidant profiling of Kale and camphorol glucoside, and you can see that Kale has a really good activity against in ABTase acid. So we always keep the amphotericin B as a standard. And this is the activity profiling against the promastigote culture of L-donophony. We did the activity profiling against the L-donophony infected golden hamster, and Kale was used. We have also done the synergistic study of Kale and sodium stevogluconate, because sodium Kale alone is not that good. So to reduce the toxicity of sodium stevogluconate, we use the SAG is commonly used for last 50 years against this visceral leishmaniasis. So we did the activity profiling of only Kale and the Kale plus SAG. So even if it has some activity reduced, so Kale has also a very good activity. You can see it is good. It is much more better than SAG alone. So to reduce the toxicity of SAG, we use Kale plus SAG, and this is the solvent treated, and this is the infected untreated control, and we decide the liver parasite burden to see the activity profiling. And then finally we did the cytotoxicity assay against U937 cell line to check the toxicity profiling of Kale. We all know that night jasmine leaves are using in different parts of India and world, as I told you. From literature we know, but the compound is isolated. We have to check the cytotoxicity of that compound. So we did a cytotoxicity assay, and you can see that the Kale has very less, it has no cytotoxicity in the assay. So in conclusion, we can say that the bioactive fraction itself is active against L-donophony infected golden hamster. So that fraction itself can be used as a herbal source for treating visceral leishmaniasis. The Kale is also a good source, but obviously that won't be so much inexpensive, because we have to purify the compound to develop the drug. So it will make some cost, and no cytotoxicity demonstrated of Kale and bioactive fraction, and the previous long history of availability and availability throughout India. So altogether, we came to the conclusion the night jasmine leaves has been suggested as an inexpensive herbal agent to cure Kala-Jar. So this is some of the related publications. The first one from Planta Medica, that is totally on Kale, and some other publications related to this work. And this is the acknowledgement for CSIR and DBT and ICMR, the government of India. And thank you very much for your questions. Any queries?
Madam, it is a very beautiful presentation. I would like to have one question. We very well know that the protozoans have the probability that they are not killed by any of the drugs right now. But is this Kale is having some property which is completely killing the protozoans, especially?
Yes, you are right. SAG is not killing the protozoa, that promastigote culture of L-donophony, but amphotericin B is active against that. So that's why we have done the Kale activity against both in vitro and in vivo culture. But still the work is going on. What is the mechanism of action? Initially we are proposing that the pro-oxidant activity is a high dose. Kale is antioxidant in very low dose, but in high dose it is pro-oxidant, and that is prevailing the killing of the promastigote. But even if it needs more work.
Ma'am, I just want to know what are the steps in this bioactive guided fractionation? I mean, what all methods of fractionation and purification you have employed?
Yeah, it is the standard chromatographic chemistry. We did the polar from polar, non-polar, and each and every fraction we got, we tested against the promastigote culture, and we kept the fraction. Again, we tested all those fractions against the L. donovani infected golden hamster, and in mice model also. And the best activity in liver parasite burden reduced, and the spleen parasite burden reduced. We took that fraction as the most active fraction. I think this is the very standard method.
Yeah.
Good afternoon, ma'am. When it is acting against the protozoan in the liver, does it have any hepatotoxicity as well? Has anything been evaluated on that side?
Yeah. Please go through my paper in Plant America. We have done the entire, because of shortage of time, I kept my this with the SGPT, SGOT assay and the liver parasite burden and these things. We did the all liver burden assay to see, and there is no biochemical parameters we did, and there is no liver hepatotoxicity of that.
Thank you.
Madam, you mentioned that antioxidant at higher dose could be functioning as a pro-oxidant. So now if you actually randomly screen plants, most of them you would land up with a antioxidant kind of activity. So can we extend the same analogy to all these plants in case if you want to work further in the line of leishmaniasis?
It needs, I don't know really, but you are right that most of the plants show the antioxidant activity. I think I have done some work in this area also, the antioxidant evaluation of traditionally used Indian medicinal plants and the plants used in Unani system of medicine. I did it, but this is not true. I think we have to have a rigorous testing procedure to check which is really antioxidant and which is initially showing. If you are checking it in DPPH assay, all of them are showing that.
Yeah,
and ADTs is the minimum screening. And then in the morning you have shown the FRP fat. That is more, so you have to check gradually, you have to go gradually to get to the final plants.
Because there are journals who actually, the minute you say antioxidant activity, they don't even consider it for.
Yeah, you are right. Every plant is showing antioxidant activity. In DPPH assay, you will get the coloring going on. The color is disappearing. But you have to be serious on that, which assay you are using.
Selection of the assay.
Yeah, selection of that.
Any more queries?
Thank you, Dr. Shumila, for a very interesting presentation. I request Dr. Mata to present Dr. Shumila with a certificate. Now I would request Dr. Mata for her presentation, whose title is Medicinal Plants from Argentina, Phytochemical Analysis and Ethnopharmacological Screening.
Good afternoon. Thank you very much for the invitation to the organizer committee of this international event. Well, I'm going to speak on medicinal plants from Argentina, phytochemical analysis and ethnopharmacological screening. Native medicinal flora of Argentina comprises 1,529 species, grouped into 175 families and 688 genera of vascular plants, that means pteridophyte, gymnosperma and angiosperma. According to the Pan American Organization of Health, A medicinal plant is any plant used in order to relieve, prevent, or cure a disease or to alter a physiological and pathological process. Also, any plant employed as a source of drug or their precursors. A phytopharmaceutical preparation on herbal medicine is any manufactured medicine obtained exclusively from plants, aerial and non-aerial parts, juices, resins, and oil, either in the crude state or as a pharmaceutical formulation. Account that medicinal plants are also evaluated by procedures such as botanical classification, identification, and characterization. The most studied plant families as medicine in Argentina are Asteraceae, Fabacea, and Solanaceae. Medicinal and commercial importance and biological applications on stomach pain, liver problems, anemia, inflammations, and diabetes. Baccharis crispa and Baccharis notosedilla are used to heal wounds and inflammations in Argentina. Other recognized species mentioned in the alternative medicine are Baccharis trimera and Baccharis articulata. All plants, I refer to all plants of Argentina. 60% species of the 96 growing in Argentina have medicinal properties. Has been studied. The diterpens labdans, the family of the labdans, are the most abundant in the Baccharis species. Also, the family Clerodan and the trichothecens. The trichothecens were discovered in fungi from the genus Fusarium. Other Fusarium, and then was detected in Baccharis species in Argentina. All other phytochemical products determined in Baccharis species were coumarins, phenylpropanols, alkaloids, essential oils, cyanogenic glycosides, and phenolic compounds. Baccharis species have allelopathic, antimicrobial, cytotoxic, and anti-inflammatory activities. Among the phytochemically most studied species we can mention, and here for reasons of time, I don't read this part. The terpene dilactonic Clerodan was detected in Baccharis trimera and showed vasorelaxant effect on the smooth musculature. This effect can be related with the improvement of blood circulation, according with the traditional use attributed to this plant. It was to mention also that the trichothecens were discovered for the first time in Baccharis megapotanica, Baccharis corridifolia, and Baccharis artemisioides, that are the only Baccharis species that produce trichothecens. Important secondary metabolites of this species of several species of Baccharis are flavonoids and diterpenes. And why? Because these compounds, with the highest occurrence in the Baccharis genus, they are described also as chemotaxonomic markers. They are present as free. Another characteristic is that flavonoids are present as free aglycones and rarely as glycosides, being a characteristic of the Asteraceae family. They have the predominant structures were of flavone and flavonone, and that have different degrees of substitution. The test of biological activity in plant extracts and purified fraction of genus Baccharis show that the biological activity and antivirus are not related to the flavonoids, but to the terpenes and trichothecens. Though flavonoids have interest in medicinal applications as antioxidants, antimicrobial, antipathoprotective, and anti-inflammatory in different experimental models. Baccharis species from Argentina that are used in folk medicine are Senecio and Eupatorium. The composition of the essential oils of Senecio mustercii, Senecio graveolens, and Senecio subpanduratus were made in these species from the Patagonia of Argentina. They have interesting essential oils. The identified compounds were the compounds cited in the projection. The biology of senecions. These have interesting biological activities, and you can say are common biological activities because they inhibited the growth of gram-positive, gram-negative bacteria, phytopathogenic bacteria, and yeast. But the interesting point is that the ratios of MBC with respect to MIC were higher than 1, and this indicate a bacteriostatic effect of the active essential oils. Otherwise, organic extracts as ethyl showed the destruction of principles that are antioxidants, and more organic solvents of and extracts against alpha amylase and alpha glucosidase that are digestive enzymes. And this activity may be related to the presence of monoamines. Eupatorium is also used in folk medicine in Argentina for the treatment of inflammation. It also has toxic and repellent properties, and contact toxicity was shown in different assays that all depend from the presence of essential oils. And the main repellency was observed for the essential oil recovered from Eupatorium bunifolium. 20 extra from were saved for cytotoxic, antimicrobial, and nematicidal activities, as well as effects on the aggregation of bovine platelets. Another family that is important in Argentina is the Fabaceae family. Fabaceae, because Fabaceae is a representative of secondary metabolites. And these secondary metabolites have high diversity, structural diversity. They have N-containing metabolites like true alkaloids, pseudoalkaloids, cyanogenic glycosides, non-protein amino acids, lectins, and also phenolic compounds and terpenes. But the main importance of Fabaceae is that have seeds that are rich in high quality proteins. Proteins with high nutritional, are a high nutritional food resource. Also for timber, dyes, resins, gums, insecticides, fibers, etc., etc. But the most important is that the traditional use of the plants from the Fabaceae family is that for the application for diabetes. As a diuretic for kidney and urinary disorders, including polyuria, cystitis, and kidney stones, as a blood cleanser and to build blood cells for high cholesterol. Paulia forficata is a tree that that is native from the northwest of Argentina. There is abundant evidence that this plant is used in folk medicine as anti-diabetic, and also they have reactive oxygen species that are implicated in several physiological and pathological processes. Because, as you know, to protect biological targets from oxidative damage, antioxidants must react with radicals and other reactive species faster than biological substrates do. Another important Fabaceae is Erythrina cristagalli, is the national flower of Argentina. The genus Erythrina is rich in flavonoids. Among the non-alkaloid secondary metabolites, phenolic acids, flavanones, flavones, chalcones, of course, and many phenolic acids were detected. With respect to the bioactivities, it was found anti-inflammatory, inhibition of platelet aggregation, tyrosinase inhibition. The characteristic is that have many compounds that are inhibitors of enzymes that are involved in many enzymatic processes in the plant. There is but another interesting result is that there is a close agreement between endomedical use of Erythrina cristagalli preparations with the reported pharmacological activities. It was also interesting to note that some compounds showed high efficacy against resistant organisms, a very important aspect, since most used drugs, especially antibiotics, tend to produce resistance to certain strains. The genus Cisalpinia is also a very interesting genus that is which plants are in the whole America and Central America. Cisalpinia echinacea exists only in northeast Argentina and Brazil. Cisalpina pulcherrima is used in Central America and used in folk medicine. And the Cisalpinia sappan and Cisalpinia bolduc have been used in treatment of inflammation and improving blood circulation, along with serving as anti-malarial and anti-helminthic for the treatment of jaundice and as a digestion. Cisalpinia paraguariensis. This for me is very important because I work on Cisalpinia paraguariensis. It's which popular name is Guayacán. It's a subtropical species that spontaneously grows in the Chaqueña region of northern Argentina. This region. This tree is used as dietary supplement and for traditional treatment of a variety of ailments. Today it's used by the rural population. We studied the antibacterial activity of extracts of Cisalpinia paraguariensis bark to compare the potency with substances currently used for food conservation, and to isolate and identify microbicidal components from the bioactive fractions, and to assess the possible toxicity through the purification process. Here are the bacteria that we used, gram-negative, from clinical isolates from the ATCC, phytotoxic bacteria and gram-negative bacteria. And we made the comparison with antibiotics and with conservers for food. This is the way, the different steps that we used for the purification of the active principles with antimicrobial activity. We say also the control of the absence of cytotoxicity, and in this other, and here is the determination of the antibacterial activity in different steps of the purification. These are the spectroscopic techniques that we use for the determination of the structure of the compound responsible of the antibacterial activity. These were 3-O-methyl-elagic acid and elagic acid. Here is a summary of the condition of the spectroscopic assays. And other property that we found in the extracts of Salvinia paraguayensis was that were vulnerable. Then we detected the anti-inflammatory activity that was assessed, but assessed with DPPH and DPPH in this case, and the antioxidant activity and the anti-inflammatory activity that was assessed by enzyme inhibition of the hyaluronidase and the inducible nitric oxide synthase. We used, we also detected the antioxidant activity by lipid peroxidation inhibition assay on erythrocyte membranes, and a cell-based assay that included the fluorescent probe dichlorofluorescein for indicating reactive oxygen species generation. We used the methodologies I showed before, and in this case we made another steps of the separation of the compounds, and we could separate the antioxidant anti-inflammatory activity. We say purification of them. But before, we determined the free radical scavenging activity of elagic acid derivatives isolated from the Salvinia paraguayensis but infusion. Here we have the spectrum of the assay with the DPPH, how the spectrum change according with the degree of oxidation of the product, and this is our experimental course. I don't know why they are here, and determine the free radical scavenging activity of the same derivative from elagic acid, but in a model, in an experimental model in which we allow the penetration, the penetration of the dye and the antioxidant substances and the production of the radicals of oxygen, oxidant of oxygen into the cell. We determined that of three compounds, these three compounds were able to go across the biological membrane and to exert the anti-radical activity intracellularly. And other comment is the highest activity was observed for non-glycosidated substances. And these are the three substances that we were isolated and identified. This was the study of other Caesalpinia, the Caesalpinia gilet, not this, the others. We were studying the same activities in Caesalpinia gilesi. That is another plant that grows spontaneously in the northwestern Argentina. Sucania punctata is traditionally used as food antiseptic and in the treatment of microbial infection, asthma, arthrosis, rheumatism, and tumors. From this plant, we have isolated the many substances, but the most studied are 2' 4' dihydroxychalcone and 2' 4' 3' methoxychalcone. These chalcones are active. Particularly, these chalcones are active, and they have, of course, antioxidant activity. They have a protective effect on the DNA breakdown produced by the UV-induced water photolysis and the lipoperoxidation. And components of Sucania punctata extracts, particularly these that I mentioned, have the capacity to inhibit the action of cyclooxygenases, which inhibit formation of prostaglandins, and important mediators in physiological and pathophysiological processes such as inflammation, gastrointestinal protection, reproduction, and cancer, and have cytoprotective effect on ethanol-induced gastrointestinal injury in rats. The other important family is the Solanacea family. Solanacea provides drugs used in conventional chemotherapy and also are used in traditional herbal medicine, and these plants are used as a source of precursors of pharmaceutical steroids. Yeah. As occurs in Asteraceae and Fabaceae, this family is also diversified in the production of secondary chemical compounds, being the main importance alkaloids. That is very, very important. They alkaloids derive from the pyrrolidins, acid pyrrolidins, pyrrolidin nicotinoids, tropans, etc., etc., and many other components that are used in the pharmaceutical industry. Another Solanacea are the in Argentina comprise 52 genera, and with the exception of Solanus species, 2 species of Fabiana and Gravoschia obtusa, the remaining ones have at least chemical or pharmacological information. Now, with respect to these Solanaceas, the most promising species is Fabiana indicata. The common name is Palopiti, on which many pharmacological studies have been focused today. Then, the most representative families with traditional medicinal activity in Argentina are Asteracea, Fabacea, Solanacea, but many other species are under study. It was to take into account that the essential oil composition of several members of the families of Verbenacea, Lamiacea, Myrtacea, and Apiacea are of central importance nowadays, because they it was reported they affect as virucidal, antibacterial, antifungal, trypanocidal, archaecidal, nematicidal, fumigant, and repellent against head lice, or to have analgesic, antioxidant, antidiarrheic, and all these effects mentioned there. But what is important is that medicinal and aromatic plants are a diverse group of plants with potential to contribute to economic development in the country. There is an increasing commercial demand of herbal, medicinal, and aromatic plants in Argentina. This is this plant. Now we are studying all these plants in my institute, and the conclusion is that the knowledge about the chemical composition and the biological activity of the medicinal flora of Argentina needs to be further developed. The northwestern region of the country are the most have the most diversity of plants in terms of native medicinal flora. And in Argentina we have all kinds of climates that allow the production of many plants. And to my criterion, a national program on medicinal germ plant conservation needs to be created. Well, this is the principal entrance to my university and some parts of the university. This is part of my group of research. And thank you very much.
Any queries? Thank you for. Hello? Yes, and thank you for a very informative paper. I was interested in your choice of antioxidant acids. You've used the DPH and the ABTS, and I wondered what influenced that choice.
Yes, because DPH is unstable substance, and ABTS it's necessary to generate or to produce the substance in the moment.
Yeah.
And it's necessary to proceed to the dosage of the production. And I have read we made some experimentation with the comparison of the two substances, but also I have read in many papers that it's the same.
It is the same. I've done comparisons between DPPH, ABTS, and Homeopathy, and the correlations are identical. We published that back in 2004. I think one advantage of the Homeopathy, and it's just a small advantage, is it's almost an instantaneous acid to set up, whereas your ABTS, you've got to generate the radical 12 hours beforehand.
DPPH is a
ABTS. ABTS.
DPPH is a free radical.
Yeah, but the ABTS acid? The ABTS assays are not more preparation, yeah?
Yes, it's a free radical, of course.
Yeah, but it takes more time to set it up. It takes 12 hours of lag time.
I don't understand.
That's okay. It's okay. The correlations are the same.
But it's the same.
It's the same.
Use one and the other.
And
when we found that it was the same, the use of the difference in the results were not statistically different, then we preferred to use DPPH.
Yeah. We found the same between the ABTS and the Homeopathy, and we published that back in 2004. So I think all three acids are comparable. They achieve the same measure.
Who knows Spanish?
Anyway.
But it's the same. Any questions?
Thank you very much, ma'am, for the presentation. You have already done a lot of work, ma'am. and I was so impressed in the various aspects that you have touched. But I want to ask that the principal goal or aim of all this investigation is for us to get a product, a molecule that could be of benefit to humankind in treatment of one ailment or the other. So I don't know, ma'am, whether I have such a goal that will eventually lead to commercialization of one or two of your findings. Thank you, ma'am.
We isolated the substances. Who is speaking?
I'm from Nigeria. Yeah, because in Nigeria we do a lot of studies involving medicinal plants. But most of these studies, they are just lying there waste. The goal of commercializing them for the profit of mankind is lacking. So I'm asking that with all this volume of work that you have done, is there any concrete steps towards commercializing our findings for the benefit of humankind? It's not just enough to do the studies. At the end of the day, we don't see the transformation, the transition of our studies to the populace that we need the result outcome of our findings for treatment of ailments affecting humans. Am I true, ma'am? So my question is...
You can ask, excuse me.
Excuse me, Dagmata. I mean, what he is asking is, is that anyway the things you have explained, the drugs and everything you have explained, is there any way that can be translated to be commercial, as a commercial product?
Yes, of course. If we want to commercial the isolated substances, he asked. Hmm?
Yeah.
Yes.
Is that what?
Well,
Yeah.
yes, this is the intention. What happened is that the legislation in Argentina is too difficult because we can make the accreditation. We cannot make the accreditation of the plant nor the product as we made the products we isolated from the plant, because this is prohibited, I believe, in all countries. What we can accredit is a modification of the isolated compound. Is that? Huh?
Yeah, that's all right. He said that's okay.
And we can then we also made a modification of a product that we obtained from a plant, of course, that for the first time, and we made the modification of this product. And now we are performing the essays of. We are other line of work, and we essay the action of new substances on as active compounds on yeast, and we have good results, and we are essaying the mixture of some commercial antibiotics with.
Sorry to stop you there. So you are saying that it will be somehow commercialized in future?
Yes, in the future,
no problem.
but not today.
Okay, that's all right. That's what he wants to know. That's all he wants to know. Thanks a lot. Thanks a lot.
Thank you, Dr. Mata, for a very enthralling presentation. I request Dr. Sharmila to felicitate Dr. Mata with a certificate.
Okay.
Thank you very much. I'm sure all of us are enjoying the session. We have many more interactive and interesting presentations coming up. We all have got our feedback forms. I request all of you to submit your feedback forms at the registration desk. Should there be any concerns, please feel free to reach out to the organizers. We appreciate your presence. I would like to put a note that the session is being streamed live on YouTube, and you can view the video on www.youtube.com/International. For our next presentation, we have Dr. Diadelis Ramirez Figueroa from National Center for State Quality Control of Drugs and Medical Devices, Cuba, and the title of presentation is Interactions Between Herbal Remedies and Medicinal Drugs, Considerations about Cuba. Please welcome her.
Okay, thank you very much. Good morning, ladies and gentlemen. First of all, I would like to thank the organizing committee, especially Mr. Muji, because since the last 8 months we have been in contact in order to get my participation, and now I am here and I will give you my result. Okay, I work for the regulatory agency in Cuba. As you know, Cuba is in America, in the Caribbean Sea, and we are going to talk in the next minutes about the interaction between phytomedicine, herbal medicine, and conventional medicine. The content of this presentation: first, we will talk about use of herbal medicine, later mechanisms of interaction, the main points about the interaction, pharmacovigilance, the network in Cuba, and final consideration in Cuba. It's some example about this interaction. The opportunity for developing of traditional medicine, all of us we know, diversity and flexibility, accessible and easy to get, low level of technology and investment, growing economic importance. Now we go directly to the mechanism of interaction. There are 3 important points that they are related, very close related, with the mechanism of interaction between herbal medicine and conventional medicine. So the first is pharmacokinetic. All of us we know that the process involves absorption, distribution, metabolism, and excretion. Pharmacodynamic is related with the mechanism of action of the drug, the effect of one drug altered by the presence of another at the site of action. And pharmacogenetics is more recently related with the drug response according to the genetic profiles of the drug, of the genetic profile of the patient related with the drug. Pharmacokinetic factor first we will talk about absorption. Changes in absorption are usually a reduction rather than increase. Also, the opposite can occur. With all this information, with all this slide, I want to transmit you, to reflect with you, that the efficacy can be modified according to all these factors, pharmacokinetic and pharmacodynamic. And the herbal medicine is not apart from them. It means that the same as the conventional medicine, the herbal medicine are also involved with all these mechanisms. Factors affecting absorption, intestinal pH, complex formation, altering gastrointestinal motility, etc. Herbal drugs may inhibit absorption by forming complex, for example, with tannin and polyphenol. In the case the drug metabolism, all of us know about cytochrome P450 is one of the main enzymes for the metabolism of drug. Cytochrome P450 and all the isoenzymes, they are able to metabolize about 60% of the drug and the xenogluten. Most important interaction mechanism for health, if for example cytochrome P450 enzymes are induced, they will also metabolize faster than any other drug using the same pathway. Applied to the weight in the case of St. George well, may reduce blood level of the oral contraceptive pill, warfarin or digoxin. Enzyme inhibition leads to increased drug level. Okay. In the case of the activation of herbal medicine, another important tool, another important information is that the herbal medicine can be reactivated. And there are three at least: formation of toxic metabolism, competitive inhibitor. The herbal medicine can be a competitive inhibitor of cytochrome P450 or no competitive inhibition. Or interaction herb and drug, in the case alprazolam plus cava, chemoprotection on carcinogenic process can be done. Now I will show you some tables related with the inhibition of CGP or no inhibition, or some herbal medicine that up to now is known that they are not able to induce or to reduce the cytochrome P450. In this case, there are some of the herbs known to inhibit cytochrome P450: echinacea, valerian, red clover, ginseng, licorice, black tea, etc. They are able to inhibit. Important herb known to induce CGP isoenzyme: licorice. If you realize, there are some isoenzymes, and here is in detail in the last table, some that they are able to reduce the CGP isoenzyme. This table is about induced CGP isoenzyme: and jingo, guarana, licorice, black green tea, and sanjon. And there is another important news that there are some herbs which don't appear to induce CGP isoenzyme. You can see in the list that it's not the isoenzyme in general. There are specific isoenzymes that they are not able to induce this one. So palmetto, soya, ginseng, tea, ginkgo biloba, and echinacea. This, as you can see, this is in general between. We have to see case to case when something happens or you want to know about something specific with the patient, the person. We have to see which phytomedicine that they are taking, which conventional medicine, and according to this, we have to elucidate what is going to happen. This I am showing you, I am giving you some general information, and then you can realize what can happen in general. P-glycoprotein is a pump found in the cell membrane. This glycoprotein affects serum drug level by blocking or facilitating entry into cell, can even eject drugs already absorbed from the gut lining. The action can be induced, for example, rifampicin, or inhibited by cyclosporin. These are the list some of the herbs that they can affect the activity of this glycoprotein. You can see, and then this is the drug affected by this glycoprotein. It means that some of these drugs are used concomitant with the herbal medicine. The efficacy can be modified. Is that I want to show you. Pharmacodynamic is another point important in the mechanism of interaction. Pharmacodynamic can be additive, synergistic, or antagonistic effect possible for combination of any type of drug, including herbal sedative, anticoagulant, antihypertensive, and other may increase effect of concurrent drugs taken for the same purpose. I already talked about this. And documented for serotonin syndrome induced with antidepressant and syndrome worth. It means that the pharmacodynamic interaction can be also be modified for the herbs when it's used concomitant with any conventional drug. Herbs also, this is another important element, can interfere with laboratory tests. In the case, for example, of ginseng, panax ginseng, they can modify the level of dioxin in serum, and this can be avoided by using tests other than antibody-based in chemiluminescence and turbidimetric assay. Another important element that is more recently is the pharmacogenetic approach, and this is the study of the influence of heredity on the response to the drug and their effect in the body. Help to understand design, help to understand inter-individual variation to the drug response. And there is a small table about the interaction, and this is not apart from the pharmacokinetic, as you can see. For example, the GALDIS, the enzyme transporter, is induction of CGP384 and also P-glycoprotein, and the drug sakinamid, they are used the same enzyme, and this can be modified the effect of the drug when they use concomitant. Now what happened in Cuba? Cuba is an island located in the Caribbean Sea, We have a network of pharmacovigilance system around all the provinces. We have 15 provinces, and in each province we have a pharmacovigilance center, pharmacovigilance point. And now this center report to the Central Center of Pharmacovigilance in Cuba about the adverse reaction. And now I am going to show you some of them. Pharmacovigilance, as we know, is the science and activity relating to the detection, assessment, understanding, and prevention of adverse effects of drugs or any other possible drug-related problem. And it is include herbal, traditional, complementary medicine, blood product, biological, medical device, vaccine. All of these are involved with the pharmacovigilance. And we know WHO guidelines, there are guidelines related with this subject. The main objective is early detection of unknown safety problems, detection of increasing frequency, identification of risk factors, quantifying risks, preventing patients from being affected unnecessarily. This is the database of pharmacovigilance in Cuba, as you cannot read because it's in Spanish, but it is related with specialty, the drug use, the presentation, the pharmaceutical form, the manufacturing. It means that there are some of elements, the details that we should know in order to report the adverse reaction. Reporting of suspected adverse reaction, the health professionals who are providers of herbal medicine, including physicians, pharmacists, and nurses, should report to the National Pharmacovigilance Center. The patient of consumer should normally report to the physician or provider of herbal medicine. They may also report directly to the National Pharmacovigilance Center. It means in Cuba we have some system for reporting a program in the polyclinic. The patient knows where to go if they have some adverse reaction. And then, of course, the manufacturer should report directly to the National Pharmacovigilance Center or the National Regulatory Authority. This is some of the drug interactions that we have found in Cuba. For example, aloe with clothalidone and erythromycin produce rash, feeling down. Caña Santa, that is known in Cuba with captopril, antihypertensive, produce low blood pressure. This is synergic effect. Guava with cannabicin, epigastric disorder. Noni with warfarin, inhibit bleeding. This is some of the proposed mechanisms of action. For example, imefasma is a side very common in Cuba used for grippe. It's a mixture of banana, stem flowers, Hibiscus elanthus, and aloe vera with propolis. And with the digoxin and captopril produce diarrhea. And it is known that the Savila, Hibiscus elanthus, has laxative property, and it is caused a depletion of potassium and consequently induced diarrhea. In the case of Caña Santa with captopril, the herbal medicine interact with diuretic and angiotensin converting enzyme inhibitor, and also produce vasodilatation and consequently redness and bloodshot. In the case of guava with multivitamin produce epigastric disorder, guava leaf contains quercetin, a flavonoid that has anti-diarrhea effect. Quercetin is the main active ingredient of spasmoditis effect. Multivitamin in some cases can produce digestive disorder, and it could have synergic effect with guava. This is some of that we have revised the proposed mechanism of action. Now I am going to show you another important element, for example, demographic characterization, the distribution of patients with adverse reaction. In the case children, the number of reports 80, 66.8%, adults 70-30 report, elderly 359, the sex, according to the sex, female more than male. Another important is the main organ system reported with herbal medicine, adverse reaction, digestive, skin, central nervous system, cardiovascular, and general disorder. I am going to finish. The distribution of patients with adverse reaction to herbal medicine according to causality, definitive, probable, possible, conditional. These are some of these elements that I want to show you. And the severity of adverse effect of herbal medicine, low severity, 66%, moderate, 29%, and serious reaction, only 0.2%. This is some of these results have been reported in this paper, And the element, at the end, the element for a strategy herbal medicine product, we should take appropriate action, discussion with stakeholders, explore the possibility of systematic studies, core studies, case control, be aware of the public acceptance of the risk and notion possible benefits of natural medicine, and balance information of the public about risk and benefit of herbal medicine will increase public confidence in administrative action. And finally, we always finish with a phrase, nature gives us the seed of the sign, but not the sign. We have to get it through the story. This is a picture of Havana. All of you are invited to go there. Thank you very much.
Any queries? Thank you. It's a very good paper. It's a very quick question. You said there was a difference in male-female adverse reactions. Does that reflect a difference in the population reporting the events? So a gender difference there, rather than a biological difference between the male and females and how they react? So is it more male are taking the herbal medicines and report adverse reactions? Or is it that there's a true biological difference between the males and females and how they respond?
You mean according the You mean according the severity of the adverse reaction?
Mm-hmm.
The law was set. I don't know exactly the question. The serious reaction was only 0.2, and the moderate was about 60%.
Okay.
Yeah.
I just want to ask you one thing. You were pointing about pharmacogenomics and genetics. And I'll just pick up an example of quercetin there. Quercetin, say, from a source in Cuba and quercetin from a source anywhere else in the world would have certain different properties when it goes to a genetic state. So if you are reporting an adverse reaction in that sense, how far is it going to be true? Because once you say something like that and you relate it with the pharmacogenomics status, you tend to generalize it, which is not going to hold true if you look at it in a global sense.
Yeah. No, yes, you are a very interesting question. You are true, because now pharmacogenetic in Cuba, for example, we don't have high level in this. Now we are starting. Even I am preparing the guideline about this, because now they are going to start some clinical trials including this kind of state pharmacogenetic. But as you know, we cannot characterize only for pharmacogenetic. There are more factors. For example, because for this reason I told you only I give you a general information that can be happen. But no, it is not only this. For example, in the case of pharmacogenetic, first you have to characterize the patient according to the metabolism, because there are some patients that they are fast metabolized or slow metabolizing, and according to the difference between the person, the response of the drug change. I think it's very important, this question, because it's not only this.
See, this goes to the other level as well, where it is the patient. Today, every country in the globe has an immigrant population.
Yeah.
So, what may apply racially to Cubans may not to the immigrant population, because genetically they have a difference.
Yeah.
And accordingly, the metabolism is different.
Yeah, it's different. Yeah.
So, generalizing adverse reactions is pretty confusing.
Yeah, according to the kind of population can change the response, the efficacy. In our case, we don't have a lot of immigration, and we are trying to characterize the Cuban population according to some CEP for P450 so enzyme. But in other countries that there are more heterogeneous population, the response changes.
Well, that's why, I mean, that's a challenge with herbal medicine when you try to characterize adverse reactions.
Yeah.
Because they have those variables from the source and to the impact, both ways.
Yeah,
that has to be considered in a very broad bracket. It cannot be a line or a pointer, it has to be a bracket.
The extended discussion can be during lunch.
Yes.
It was a pointer that.
No, if you want to focus that the example that I put about pharmacogenetic is not in Cuba. There are some examples from the literature, but not in our country. We have to to work in this field.
Thank you. Thank you. The next speaker.
Thank you very much, Dr. Daidavis, for a very nice presentation. We will have all the certificates at the end of the session for saving time. And I would also like to remind all the speakers that we'll conclude each and every presentation in 15 minutes because we are very running short of time and we have to start with our poster presentations post-lunch. For our next presentation, I would like to invite Dr. Jules Clement Azog from University of Biao, Cameroon, and his title of presentation is Protective Effect of Otronella conglonesis and Sapium ellipticum stem bark extracts against hepatotoxicity included by thioacetamide.
Good afternoon. I would first of all like to thank the organizers of this conference on traditional alternative medicine for inviting me and for giving me the opportunity to present our research work on protective effects of Otronella congolensis and Sapium ellipticum stem barks extracts against hepatotoxicity induced by thioacetamide. In Africa, attitudes towards traditional herbal medicines vary strongly because of the confusion between herbal medicines and witchcraft. The use of medicinal plants is often associated with superstition and therefore rejected by some people. However, there are many Africans who prefer traditional methods of treatment. Traditional healers and remedies made from plants play an important role in the health of millions of people. The relative ratios of traditional practitioners and university-trained doctors in relation to the whole population in African countries are revealing. In some cases, we can have one traditional doctor for 500 inhabitants compared to one trained doctor for about 10,000 inhabitants or 20,000 inhabitants. Most developing countries are endowed with vast resources of medicinal and aromatic plants. Therefore, these people are precluded from the luxury of access to modern therapy, mainly for economic reasons. Numerous medicines have been derived from the knowledge of tropical forest people, and clearly there will be more in the future. Africa has a long and impressive list of medicinal plants based on local knowledge. Plant use in traditional medicine contain a wide range of substances that can be used to treat chronic as well as acute diseases. However, available herbal products are not accessible to most patients. Liver diseases are considered as a major worldwide health problem. They are generally due to liver infections or ingestion of toxic foods, chemicals, and overdose. The susceptibility of the liver to chemical attack is mainly due to its role as a primary organ, which comes in close contact with many harmful substances. Nevertheless, some of these metabolite derivatives are toxic to cells and in some cases can induce hepatocellular carcinoma. Thioacetamide is an hepatotoxic agent that is converted by the liver enzymes to highly reactive toxic X-oxide derivatives, which cause centrolobular necrosis. It is well known that the mechanism of liver toxicity by TAA involves free radical chain reactions. However, among herbal products available commercially, only few have been studied and standardized. Silimarin, an example of an herbal-derived drug, is a mixture of natural phenolic constituents. Sapium ellipticum and Otronella congolensis are examples of plants which are used in Cameroon by grassroots and forest people, respectively, for the treatment of various ailments, including liver diseases. The scientific basis of their use is not yet proven. Their phytochemical investigation indicated the presence of phenolic derivatives. This study therefore aimed to evaluate in vivo their hepatoprotective activity using triacetamide's model. Based on ethnobotanical surveys, Otranella congolensis and Sapien ellipticum were harvested in the east and west regions of Cameroon, respectively, and were identified at the national herbarium. The dry bark powder was extracted using methanol. The extracts were then used for acute toxicity and hepatoprotective activity. The acute toxicity was performed using the OECD guideline. The hepatoprotective activity of the plant extract and product were tested using triacetamides as hepatotoxicity. A total of 45 animals were divided into 9 groups of 5 animals each, and they were treated as indicated below. Group 1 served as negative control. Group 2 and Group 3 served as respectively as Sapien ellipticum and Otranella congolensis control. They all received 1 meal. They were treated with 0.5 subcutaneously with normal saline every 72 hours for 29 days. The toxic control group 4 received 1 meal of gum acacia and was treated with triacetamides subcutaneously every 72 hours for 29 days. Group 5 and Group 6 received respectively Sapien ellipticum at the doses of 100 and 200 mg per kg oral, whereas Group 7 and Group 8 received Otranella congolensis at the doses of 100 and 200 mg per kg. The standard drug used was silimarin and was administered to Group 5. All these were treated with triacetamide every 72 hours for 29 days. On the 30th, the overnight fasted animals were anesthetized with ether, and blood was collected by puncturing the orbital plexus. Serum was separated by centrifugation and used for various serum biochemical markers. The next day, rats were sacrificed by decapitation. The livers of all animals were perfused with ash coal for saline, removed and processed for other investigations. The hepatoprotective activity was evaluated biochemically and histopathologically. Liver markers measured in the serum were total serum protein, total bilirubin, direct bilirubin, serum albumin, and transaminases. Liver antioxidant markers were also measured. Liver total proteins, reduced glutathione, lipid peroxidation, cataracts, and superoxide dismutase, as well as cytochrome P activity were determined. The results were expressed as mean plus standard deviation. Each parameter was analyzed separately using ANOVA, followed by density test for statistical precision. So results are here presented. It can be seen that the administration of TAE markedly increased the level of the liver weight, markedly increased the level of the activity of transaminases, GPT and GOT, as well as alkaline phosphatase, affected the total level of total protein, as well as the total level of serum albumin levels, and increase the total level of total bilirubin. With the administration of Sapien ellipticum at the doses of 100 and 200 mg. And this was comparable to silimarin, the standard drug tested in the same condition. The activity of Otranella congolensis was similar to that of Sapien ellipticum. We also that were altered with the administration of geoacetamide. This was comparable to that of sidemarine administered in the same conditions. So, serum glutamate pyruvate transaminase levels are very high in patients of viral hepatitis and hepatic necrosis, 10 to 204 higher in patients of post-hepatic jaundice, intrahepatic cholestasis, and below 10-fold in patients of neoplastic carcinoma, cirrhosis, and alcoholic hepatitis. Administration of Botryella congolensis and saprophytic extracts to intoxicated animals decreased significantly the serum level of these enzymes in toxic groups of animals, showing a protective effect of those extracts on the studied model. Evaluating the antioxidant markers at the level of the liver showed that the administration of geoacetamide markedly increased the level of lipid peroxidation markers used by monitored by the measurement of malondialdehyde. These parameters were markedly reversed with the administration of the congolensis dose dependently, and this was comparable to that of sidemarine tested in the same condition. The activity of superoxide dismutase was markedly reduced with the administration of geoacetamide, but this was reversed with dose dependently with the administration of the two extracts and was comparable with that of the standard drug administered in the same condition. We also observed that the reduced glutathione was markedly reduced with the administration of diacetamide, but this was reversed dose dependently with the administration of the two extracts, and this was comparable to that of sidemarine tested in the same condition. The activity of catalase was also affected in the same manner. So free radicals are reactive models involved in many physiological processes and human diseases such as cancer, aging, arthritis, Parkinson's syndrome, ischemia, and alcoholism and liver injuries. The damage to hepatic parenchymal cells leading to hepatic injury is due to oxidative stress within the cells caused by reactive oxygen. The elevation of lipid peroxidation levels observed in toxic group during the liver damage can be linked to enhanced production of free radicals and decreased scavenging potential of these cells. The latter was illustrated by low levels of antioxidant enzymes, catalytes, and metabolites. This observation suggests that these two protect the liver against either vascular species or by inducing the endogenous antioxidant system pathways. Histopathologically, we can observe that administration of geoacetamides induce lipid infusion in the liver, and this was reversed with the administration of the two extracts dose dependently. The protective effects of these two methanol extracts observed in the present study justify scientifically the use of these two plants by traditional healers for the treatment of various ailments. We can thus anticipate the use of these extracts against an array of diseases like viral hepatitis, aging, arthritis, and liver injuries. We acknowledge the Center of International Cooperation in Science, India, the College of Pharmacy of Tunku, India, and the Research Foundation of Tropical Disease of Environment. Our research teams, our extraction units, some products in the unit, and thank you for listening.
Thank you.
It was really very nice, interesting presentation by you. I would like to have one question that in all the parameters of the liver, you have shown the ALP levels were not significantly decreased by the medicinal plants. So what is the reason behind that?
Lipid peroxidation.
Alkaline phosphatase.
Okay. Please let me go back to the slide.
ALP. Yeah.
Okay. We can observe here that ALP levels were not mainly affected by administration of the extract.
Yeah, that's
I think it's because alkaline phosphatase is a marker of cholestasis, and the mechanism of action of triacetamides is mostly on the affection of the hepatocellular on the liver cells, not at the level of the bile duct. And in this case, the extracts must act by reducing the oxidative properties of triacetamides.
So basically, the alkaline phosphatase is responsible for any of the liver injury or damage or any type of disease which is existing in the liver.
Generally, increase in alkaline phosphatase.
If it persists after the administration of your medicinal plants, also means there is very little recovery. What I see in the ALP. So in that condition, what you would like to suggest that it is completely combating the liver disease or superficially at some extent.
Or you can also attribute this to the mechanism of action of the extracts in trying to reduce the effect of the toxic substance.
Thank you.
Thank you.
Thank you, Dr. Jules. That was a very nice presentation. We'll have all the certificates during the closing ceremony of the session. In respect of time for all the presentations, we have delayed the lunch a bit, which will be after the closing of this session, and you all can subscribe to Omics Group channel on YouTube for viewing the live streaming of this session. Next on stage we have Dr. K.S.N. Jyoti from Acharya Nagarjuna University, India, and the title of presentation is Oxalis corniculata, Potential Herb in the Treatment of Diabetes.
A very good afternoon to all of you. At the outset, I would like to thank Omics Group for giving me this opportunity to present a very small piece of my work. To begin with, my basic interest in plant biochemistry made me take up this medicinal plant research is my topic for research. And I should mention you that my place of work actually is a University College for Women, Hyderabad, which has a very rich plethora of plants. So when I began with my research topic, I could find out that my college has almost 80 to 90 medicinal plants present there. So with the help of a professor in botany, I picked up analyzing these medicinal plants for the scientific investigation. When I dwelled more into the literature search, I identified the significance of traditional medicine. So here we all know a little bit of introduction. So traditional medicine is a re-emerging term for a hopeful and healthy life. It represents a multifaceted approach to restore health. Now it is affirmative because it understands the intricate design of human mind-body complex. Health management through traditional medicine is not new to us. It has been there from times immemorial. Now why do normally people are reverting back to traditional medicine is because of the population rise, inadequate supply of the drugs, and above all I should insist on the last point, that is the development of multi-drug resistant diseases. So the presently available antibiotics, most of them are not able to work on the diseases because of the drug resistance of the pathogens. So this is a little difference I could make out from the literature, the basic differences between the synthetic drugs and the traditional medicines. The drugs basically are chemically single entities, whereas the traditional medicinal compounds are biochemically active complex derivatives. And it is very difficult to patent a particular medicinal element from a particular plant because most of these traditional plants that we know as medicines work as a whole. As entities themselves they are active as medicines. And their low cost and less side effects maybe are a more interesting fact to go to traditional medicine. Now, this is a new term you all now are hearing, that is lifestyle disorders. So there are a lot of lifestyle disorders which are chemically very complex diseases which cannot be treated by any one particular drug. So I think traditional medicinal plants are a resort for the treatment of these lifestyle disorders. And the most of it that we know is diabetes. It has a very high global prevalence, and India is now termed as the diabetic capital of the world. So we were actually looking at the plants that can actually treat diabetes, and one of the factors that can treat diabetes is the alpha amylase inhibition and alpha glucosidase inhibition. So I picked up this topic of interest where we were trying to screen medicinal plants that have alpha amylase inhibitory potential. So as the first objective, we tried doing a comparative analysis of more than 50 plants available in our college for the alpha amylase inhibition against porcine pancreatic alpha amylase, which is a commercially available enzyme, and starch as the substrate. So the first objective was to comparative analysis of the alpha amylase inhibition of Oxalis corniculata with other known medicinal plants. Then we tried, we are now in the second step of my work where we are trying to identify the candidate inhibitor using chromatographic techniques. The further would be characterization of the active inhibitor and then structural determinations. So why did we log on to this plant is because this Oxalis corniculata is a very small herb. Now this is a known medicinal plant with a lot of potential, treatment this thing. It is traditionally known to be used as anti-inflammatory, digestive, diuretics, antibacterial, antiseptic, cardiopathy and hepatopathy. But there are no studies that have been done on the alpha amylase inhibition of this plant or its role as anti-diabetic. So we picked up to study this particular plant, that is Oxalis corniculata. Now the phytochemical screening of this plant has already been done, and we have done it in our lab where we have proved the presence of flavonoids, tannins and glycosides. Now, because of the lack of scientific evidence, we proceeded with our first objective. This is the routine procedure that we have done, sequential solvent extraction of the plants of almost 34 to 40 plants. We have done all the polar to non-polar solvents analysis, and all the extracts we have studied them for alpha amylase inhibition against porcine pancreatic amylase, and the extracts that have been showing the higher inhibition were stored. And we also studied the IC50 value of these extracts against acarbose as the standard drug. Of all the extracts analyzed in the first study, aqueous extract of Oxalis corniculata exhibited an IC50 value of almost 68, which is much less than that of the standard drug acarbose. So I tried consolidating the data that we have, and you can see the 15th plant, that is Oxalis, which is in red. It has an aqueous extract showed an inhibition of almost 86%. Now please let me know that all these are crude extracts. We have just taken the plants, did the extracts, and then analyzed to their enzyme activity. Now, we also did the standard acarbose amylase inhibition, and we compared it with that of Oxalis corniculata. We used GraphPad prism analysis for calculating the IC50 values. Now, because this plant has shown good IC50 value, we are hoping that it would have a stable inhibitor against alpha amylase. So with the hope to identify an inhibitor, we have proceeded with our protein purification techniques, and the literature search actually has shown that most of these amylase inhibitors that have been identified so far from the wheat family, bean family are all protein inhibitors. So with a view that this would be a protein inhibitor, we have started with the purification techniques. We have done the ammonium sulfate precipitation from 0 to 100%, and we got a very clear pellet at 30% to 60% saturation. And all these pellets that we have obtained after ammonium sulfate precipitation, we have gone for dialysis. We have dialyzed them against phosphate buffer saline for almost 24 to 48 hours. And these dialyzed samples, after ultrafiltration, we have gone for ion exchange chromatography against DAE cellulose column. This is a cation exchanger. We have run it on the samples. Now, the ion exchange fractions have been collected, and we have calculated the absorbency to 80 nanometers of all the fractions, and we have observed that these fractions at 6th and 7th peak have shown. I could not show the results on this because we are still repeating the procedures for confirmation again, and we have also run these fractions on SDS page, and we have observed a mild protein band which also might, which is a convincing factor that the inhibitor might be a protein. Now, this is not enough to confirm the activity of the inhibitor, neither the nature of the inhibitor. So, I still have to go for HPLC. So, these are the next analysis that is to be done, is to get the HPLC and mass spec analysis of the inhibitor done. And there are a lot of bioinformatics studies that have already been done on a lot of amylase inhibitors that have been isolated from the bean family and the triticase family. So we are trying to get the sequence done and then compare it with the in silico inhibitor structures that are already available. So the last 3 steps are yet to be done, that is the in silico structure prediction and the comparative structure analysis of the inhibitor. I cannot actually conclude the work that I am doing because it is still in the process. So the only conclusion I can give that we have to use this rich plethora of flora that we have with us to alleviate suffering and disease, and the scientific lacunae in the medicinal plant research must be bridged so that man can effectively treat all lifestyle disorders and other potential diseases using the safer and effective herbal drugs. Thank you. Thank you.
Thank you very much, Dr. Jyoti, for your respected time. Next, I request all the speakers to be present during the closing ceremony where we will be distributing the certificates to you. Next, we have Dr. Sharadvata Pan from Indian Institute of Technology, India. Do we have Dr. Sharadvata?
Right behind you.
Oh, I'm so sorry, sir.
Right. Just one thing. So, sir, can you hear me without any mic? Okay.
We have a cordless mic, sir, if you want.
No, can you hear me without the mic? Yeah, I think that will be better.
You want me to help you with the presentation?
Yeah, just click on the Sharad. Click on the. Right. So I'll just jump straight onto the band organ without any introduction. Just thanks to all of you who have made this trouble to drag out of me from my research lab in IIT Bombay to straight to here. I think that takes care of it. So, audience, a question which has been intriguing and baffling this entire herbal community from the quality perspective was that is there a total quality system that can be injected into the manufacturing and processing of herbal products? After almost 6 to 7 years of, you can say, active and passive research, we are finally seeing some light at the end of the tunnel. Yes, it's very much possible. You know, it's today very common that a lot of global celebrities have started endorsing these herbal products and supplements. And if that is not enough, we have our own desi famous for it. But if you are an ardent looker into these newspapers or the media reports which are coming out,
Sir, I'm really very sorry to interrupt in between, but I think you will have to use the mic.
Okay, right. So, if you are really turning out the pages of the newspapers, you can find out that there has been some apprehensions and concerns regarding the status of these herbal products in the media. And coupled with that, coupled with some of the slapsticks and the cartoons that have been appearing in the now, in spite of the dilemma, there is no doubt that herbal products are hot, because primarily because you can use this along with this allopathic system of medicines which are fairly common today, and this can also give decent healthcare to the majority of the global population. Mind that in developing countries, more than 3/4 of the population needs this, is scattered to these classical systems of medicine. And as Jyoti pointed out, Madam pointed out, many pointed out that whether it's common disorders or uncommon disorders, whether it is endemic, non-endemic, the treatment of these has always been a challenge, and herbal product seems to be of good use. Now, not for no reasons, however, that the market value has doubled in the last 7 years. Now, this figure many can tout, but we are sure because we have used extensive market analysis techniques in IIT labs. Right. So, what's the status of these herbal products as complementary and alternative medicines? Should we be overly ecstatic? Should we be totally in love with them? Well, if you believe so, I mean, if you look at some of the news which has come up, it seems that almost in every area of disorders, herbal products are actually putting their stamps. And mind you, these are very, very recent results. But as there are same, like to every incident, and as there are two sides at the same time, incidents of thumbs down has also been reported. I had to take much, much less time than could consider the other one. So all this has just a cartoon. A similar, raised a concern. Do we totally love it? Should we totally show it? What should we do? Okay, let's try to find the answer then. In order to find the answer, first you have to focus on the existing natural path of this product. So, as we have pointed out in this paper, they have pointed out, and also we have pointed out that there is some degree of fallacy. So, some of the common concerns that are associated with these natural products are that, all the active ingredients might not be known. The chemical constituent might not be fully known. There might be some batch-to-batch variations as a result of variations in agricultural practices. But the common line is, or the bottom line is, that along with these non-botanicals, these botanicals can be subjected to the same quality control steps. And therefore, it is a quick procure, it is an absolute must to incorporate several quality control techniques or analytical techniques as much as possible into this production process so that you get an adherence to these regulatory norms. Right. Now, okay, medicinal plants can be collected or rather can be obtained via two main methods. One by this wild collection or rather by cultivation. And it's layman's understanding that through cultivation you can actually increase yield, which will result ultimately in this, give you a better supply of raw material. So this is this existing supply chain which you have reported in our recently published paper, right from producers to consumers via local contractors. But a gap analysis of this has turned out that there are some lacunae. So one important challenge in the area of standardization is that all these plants contain a lot of constituents, phytoconstituents that might contribute to their bioactivity. And so not only there should be a consistency in the content of these desired constituents, rather the end product has to be produced in a form which can be readily absorbable to the human body. That is extremely important. So, okay, lot of queries. What to do? So in our paper, we have suggested a simple four-way approach to optimize the supply chain. Now, these are all proposals, not has been substantiated. So I cannot tell you that they are 100% safe and effective, but at least we have tried to solve this. So there should be some, don't jump onto the bandwagon straight away. Please do some research because it has been to our knowledge that 90% of the failures which occur because of less primary research with all these initial plant species. Now there should be this enhanced cooperation between farmers which will solve your hindrance to raw materials. I think this procedure needs the maximum focus because the government needs to ensure that the post-harvest facilities are also there to cater to the needs of the farmers because currently this is lacking and leads to poor yields. And of course, there should be some form of collaboration between the industry and the farmers. So you cannot simply forget your base. Your farmers are the base. People have tended to forget this for years and have suffered. Please don't do this. Now, okay, so fine. It's my honor here to present this talk, and I have so many excellent presentations today. Many have focused on isolated studies, which are absolutely necessary. But then, if you look at an industry scale, you cannot do that. You have to look at the overall picture. So what we have tried to do is a two-way approach of first find these critical control points within the production process and try to do a hazard analysis to stop the process where required. Then a process analysis still now I haven't. But anyway, what is this process analytical technology? Process analytical technology is the latest thing or the in thing which denotes a change in the pharmaceutical production process from a more of a static batch manufacturing process to a elaborate systematic approach. And it's a continuous approach. So what it involves is it defines the critical process parameters inside the process which affects these critical quality attributes because this actually affects the production equipment that is used to make a product, and then simply trying to define or rather controlling these critical quality attributes within the defined limits. This will in turn help the manufacturer to produce the process or the products with uniform success or ability, same time continuously, and therefore it can also help to streamline the processing costs. Now the big boss, the FDA, what does it say? Big boss says that you cannot test your quality onto the product, but you have to test the quality by design. That has given rise to this entire concept of QBD, which is nothing, just a step of continuous improvement by understanding both the product as well as the process, as Susan might have pointed it out in some slides. Now, how will you do this PAT? Is it a very simple thing? This thing, you can say it's a hand-waving argument, but at least you can think of the procedure of how to do this. As we have elaborated in our paper, I'll just be very short because this is a lot of bookish stuff. So you can use either indirect or direct sensors, or you can use knowledge-based or continuous improvement tools. Data analysis can be through a single, which is univariate, or which is multivariable analysis, or you can use feedback and feed-forward tool. But according to me, a more sensitive approach is to look at the way you evaluate this using this PAT tool. In the first two procedures, you take out the sample and analyze it in a production facility, or testing facility, which is away from the production area, and therefore you do not return the sample. In the online, the opposite thing happens, and therefore you minimize the loss of samples. Real time can be without the insertion of probes. That is, without insertion of probes, I can tell you that Raman spectroscopy is a very good technique which we have been seeing. But another thing is, which nobody suggests, is that, as Solomon pointed out, that will this be feasible? Are these hyphenated techniques really feasible onto this? Now, you can analyze this on a common two-dimensional scale of business versus analytical dimension, which we have showed in our paper. If you want a high detection performance but you don't have money, please resort to a second-grade UV visible spectrophotometer. If you do have a lot of money, you are always free to go to the big brothers, because the big brothers can do all the analysis for you, and FTIR, near FTIR, and all that stuff. Similarly, if you want high selectivity, please resort to imaging. If you have a lot of money, you can always again go to the big brothers, because this Raman spectroscopy, I can tell you, is a very good tool to analyze this molecular geometries and all that. Right. So, due to the time constraint, I cannot explain this entire procedure to you, how we have step by step shown that process analytical technology combined with quality by design can be implemented into a production procedure of a herbal drug. So I'll just focus on few points. You can always look in the paper. PAT and HACCP are not meant to overthrow the CGMP system. Rather, they are tools for better execution of CGMP norms. Hence, determination of CCP is of absolute importance. For example, this handling stage is a CCP. How it is important? Because the quality of the product that you can determine at the subsequent stages is important, that the identification of that, it depends on the identification of that in the previous stage. So it's not a forward system, but rather a backward approach, but it helps. And then, the second thing is, a lot of questions have arisen regarding this Ayurveda standards and parameters. Many people have asked me, are these the PAT tools by themselves? No. Ayurveda parameters are not PAT tools by themselves, but rather they can be analyzed by state-of-the-art PAT tools. And there must be a minimum quantifiable limit or parameter that should be set, and you need to stick to that prior to your processing, because that will help in determining the overall cost. If you focus onto these black boxes, these are actually the PAT evaluation technique. You can do a microbial evaluation, or you can do a component evaluation. The component evaluation technique can help you determine the minimum level of the active ingredients that can be present. If you want to improve the quality of the water-based system, you can always resort to this water quality testing instrument. You can also improve the control by implementing different mathematical tools. But last and not the least, all these statistical tools, which people tend to ignore many a times, are of absolute importance. Our analysis have shown that this actually controls 70% of the success. So, but as easy as it seems, is the path all rosy? No, there are challenges ahead. Of course, as we have pointed out, that, for example, unacceptable CCP determination will lead to poor application of verification and therefore unreliable product. Hyphenated techniques? Well, You cannot ignore that they are of very high cost and they're expensive, but would you also ignore that they are so much efficient in high throughput characterization? I mean, you looked at Susan's presentation, how beautiful results she has got and how beautifully she has published. Would they be possible without all these things? Okay, right. Evaluation parameters I just elaborated. According to me, if you ask me, the most important challenge will be to control the environmental and genetic variations, because that can lead to batch-to-batch variation. And as I just told, this can only be done by quantifiable minimum parameter setting and then trying to adhere to it. To wrap up or to conclude, we have suggested a step-by-step approach, proposed, not validated, but have shown that a double approach can be of use. This has to be validated, and we anticipate that we won't be 90% successful, but then maybe of some degree. Bioprocess and manufacturing can be improved further, but please note, you simply cannot count your dollars or your money or your euro based on or sitting on the crops of the farmers. You have to give credit to the grassroots level farmers. They are the workers for you. With this, okay, so it's very simple, isn't it? If you don't implement quality, the balance will tilt the other way. If you implement the quality, you may, reach up to the level of beauty. Okay. And I'm very lucky to have a very hard-working team for the past 6 and 7 years, which we're doing, apart from our normal stuff, of course. So this work was a joint collaboration between India and Australia. So I must thank Indira and Michael for their extensive, inputs and lots of insights into this. Abhishek and Prashant for what goes into the pharmaceutical manufacturing procedure. Shivam for his extensive expertise in forecasting and analysis, which has helped us a great lot. And lately, Ashwini has been of great use. He contacted us and he said that the market value for all those which you have suggested can be of tremendous use. We are grateful to him. And I just end by saying that this is a proposal, but anybody interested in validating this, I'll be very happy and we can talk later. So I think with this, Professor Rajshekar.
First of all, I congratulate you for a very good model. Have you even not tested even a small scale this one?
No, actually, just to elaborate on this point, as Professor Chatterjee, Susan, or say several others, they're doing isolated stuff.
No, as you said, they're all in isolated, so not as you proposed.
No.
They have taken some medicinal plants and done the quality. That is always easy because you have control over the system. In your case, because this medicinal plant sector in India, if you take, there are so many actors, and it is very opaque system. So how you are going to implement this system, even in such a situation, the control will be lacking in all. And cultivation of medicinal plants in India, only 70 species are cultivated so far. In China, more than 150 plants have been cultivated. So how you are going to bring the control and how you are going to bring the quality? I think the practical situation will be very difficult.
I know, and that's why Rajshekaran, you tell.
No, I think the possibility is there if all the actors come together, and that will be a very difficult task.
Exactly. You know what? This was such a hand-waving task when we first originated it. Many people thought we are mad, and it was only because of this 2-month review stage.
Only mad people make a difference.
Yes, and only because of 2-month review stage in Nature. Actually, we thought it would be accepted in Nature, but ultimately they pushed it through. But the comments were so beautiful that it was readily accepted by this American Pharmacists Association. We are thankful for that. So, I was always looking forward to talk to you, Rachel. Yeah, anything. Congratulations from Mike to your excellent presentations, of course. I'm sorry I'm taking a bit time.
Thanks, Sharad. I don't have any questions. I just want to say that this was wonderful, and on behalf of Ayurveda people who understand technology, I would definitely say that this goes a long way. But as he said, the challenge remains that it remains adopted.
Of course.
Thank you.
Thank you.
Thanks to IIT for this.
Thanks.
Thank you.
Thank you, Dr. Sharad, for a very, very interactive presentation. For our next presentation, we have Dr. Dinesh Kumar from Government Medical College and Hospital, and his title of presentation is Some Epidemiological Aspects of Complementary and Alternative Medicine Used Among Cancer Patients.
Good afternoon. Thank you for giving me the opportunity of to present the paper entitled Some Epidemiological Aspects of Complementary and Alternative Medicine Used Among Cancer Patients. With an increase in chronic disease conditions like HIV/AIDS, infertility, diabetes, cancer, the use of complementary and alternative medicine is also increasing. Even modern medicine experts have recognized well the importance of traditional system of and holistic approach is the need of the hour. But there are so many questions of prime importance whether these complementary and alternative medicines are really safe, whether patients are using blindly these products, keeping their treating physicians in dark. Blind use of CAM may affect the clinical outcomes as well as diagnostic procedures. So it's really a question of prime importance, and so many other questions still remains. So therefore the present study was planned whether to investigate the status of knowledge, attitude and practice of CAM among cancer patients, and to explore some correlates of CAM use and some other epidemiological parameters. And this is these findings are based on a very small pilot survey of a detailed project. And we have a qualitative survey we have conducted among cancer patients attending the GMCH, radiotherapy OPD, and these are the pieces of information which we have taken from them by interview method. And in case patients were unable to give the answer, their close relatives attending the OPD were interviewed. Views of respondents concerning awareness, perceptions and beliefs regarding parameters, cancer, CAM use, sources of CAM awareness, reasons of using CAM, cost effectiveness of CAM, perceived benefits, positive and negative notions concerning CAM, challenges and problems, spirituality, healing and other parameters, and their views regarding holistic approach were also explored. These were some outcome variables. What is the CAM use pattern? What are the perceived benefits of CAM use among patients? What are the perceived reasons? Opinion regarding existing treatment modalities, sources of awareness regarding CAM and spiritual health, etc. This pilot survey included only 69 male and 71 female patients, representing all socioeconomic classes, different demographic parameters. Out of them, 87 were vegetarian and rest non-vegetarian. Different socio-demographic classes were represented. Among 15.7%, there was history of family. There was family history of cancer. And when they were asked whether they are satisfied with the conventional therapies of cancer, 88.6% were satisfied with the conventional therapies. These were different types of cancer. Due to lack of time, I am not going into the detail. And they were undergoing different type of therapies: allopathy, radiation therapy, chemotherapy, surgery. These are the awareness and practice of different CAM. The awareness regarding traditional system of medicine, different types of CAM were quite satisfactory. Regarding Ayurvedic treatment, 74.3% were aware, but practice was not up to the mark. Up to that extent, there was a large gap existing. Similarly, for Unani and other systems, Siddha treatment, etc., awareness as well as practice was very low. Different therapies like laughter therapy, physiotherapy, etc., were also
reported. When patients were interviewed regarding perceptions of their perceptions regarding positive and negative motivations for CAM, most of them were disagree that they were agreeing that these are inexpensive, easy availability, more effective, quick and additional relief. Some large proportions were we have observed they were agree to this all these motivations. Some were disagreeing. So there was no clear-cut picture regarding. So there are conflict findings. Some of the are of the opinion that they were in favor. About 18% were of the opinion that there is no modern medicine exists for cancer. So these are some of their opinions. These are the practice of CAM use. 19.3% were using CAM currently also, and 29.3% used in past. Overall CAM use percentage was found to be about 48.6%, whereas in diabetes in our earlier paper about 72% patients were using CAM therapies. Regarding perceived relief, 44.1% patients felt relief by using CAM, and 60.3% were having faith in CAM. Different types of cancer, there were patients of different types of cancer, and among all those patients, CAM use was reported. When they were asked whether who gave them advice using CAM, family members or friends was the main source of advice, and about 88.2% were satisfied with these CAM therapies. These are the misconceptions or their opinion regarding this cancer. 24.3% patients were of the opinion that cancer is due to displeasure of God. And these are the different perceived symptoms as they reported. Because this was a qualitative survey, we have not manipulated or whatever they have told us. We have also analyzed our data by using logistic regression analysis. What are the different factors using CAM responsible for CAM use? And it was found that religion was the main correlate for responsible for CAM use. So these are some conclusions we have drawn based on this pilot survey, that there is high degree of awareness regarding CAM use among patients and their family members. Practice of CAM for cancer is also high, irrespective of their socio-demographic characteristics and type of cancer, etc. Whatever may be the site of cancer, whatever may be the socio-demographic profile of patients, they are using CAM. Although there is a large gap existing between knowledge and practice. Knowledge was very high, but practice there was wide gap. And there are varied motivations in favor of CAM use. So these are some suggestions. Blind use of CAM prevalent among cancer patients may affect adversely diagnostic and treatment decisions. There is a need of holistic approach of patient care as felt by patients also, as indirect preferences to this approach. Perceived benefits of CAM, if any, should not be blindly ignored, otherwise our patients will be deprived of the CAM benefits. So there is an urgent need of conducting further in-depth epidemiological studies to evaluate the efficacy of various CAM therapies in cancer and other disease conditions. And After conducting this pilot survey, we have a research project has been funded by ICMR, and we are already conducting that detailed survey, and detailed survey results are awaited. So we acknowledge Indian Council of Medical Research for financial support of the project and assistance provided by all our research team. Thank you.
Any queries? Any queries from the audience?
We can give you in time.
Thank you very much, Dr. Siddinesh, for a wonderful presentation. With this, we come to the end of this session. And on behalf of Omics Group International and International Conference of Traditional and Alternative Medicine, I thank all the speakers for making this session a super success, and we really enjoyed all the presentations. I invite Dr. Sharmila for her closing remarks on the session.
Thank you for inviting me for closing remarks. I came a little bit late in the morning, so I missed the first few slides. Anyway, but the presentation throughout from the morning till now is really excellent, and the ideas and the research were going on. We can conclude that we need extensive evaluation of herbal products, and which came out that is the quality control is a major issue. Whether we'll do it isolation or the scheme proposed by Dr. Pan, all are very interesting and promising, but quality control, as we all know that the geographical variation, the environment, the batches, the change in the products, even if we are doing the same thing in the same lab, with the same students, we are getting different results. So quality control is a major factor for herbal research, and we have to be careful throughout the world to get the good result in future. And this is very promising thing is coming up, which has no side effects or very less side effects in comparison to the allopathic medicine. Thank you.
Thank you very much, Dr. Sharmila, for your enthusiastic words. Can we have Dr. Mata to felicitate Dr. Sharmila?
Certificate for chair, I think.
Please, a huge round of applause for both of them. They have been very supportive throughout the session.
Madam, hold it. Yes.
I request Dr. Mata for her concluding words. I request Dr. Mata for her concluding words on the session. Just a few words, ma'am.
Mi certification. ¿Quién me lo va a dar? Who is going to give me the certification? Yes. Yes.
Dr. Mata.
It's necessary.
You can say a few words.
I believe that we had a very good experience by the contact among people that came from different parts of the world, and I am happy to be here with all of you, and thank you very much.
Thank you very much, Dr. Mata, for your amazing words. Can we ask Dr. Sharmila to felicitate you? Thank you, ma'am.
Yes, ma'am.
Thank you.
Thank you very much.
Madam,
On behalf of Homeopathy Group,
To give the certificate.
Yes,
All
ma'am.
by name? Just
I will invite all the speakers for their certificates. Can we have Dr. Diabetes?
Yes.
A round of applause, please, everyone. We need to appreciate all the input that they have put in. Can we now have Dr. Jules?
Madam, yes. Wait a minute. Okay. Okay. Over.
Can we have now Dr. K.S. Sanjoti?
Madam, come in the middle. Middle. Yes.
Dr. Sharad.
Madam.
stand in this way.
Yes, ma'am.
Well done.
Yes. Yes. Thank you.
And now Dr. Dinesh.
Topic. Congratulations.
Yes.
I really appreciate all the time that you all have put in into this session, and they were really amazing presentations. And now the area is open for lunch. You all can enjoy your lunch. Post lunch we will have poster presentations at the same venue, so you all are welcome there. And please enjoy your day. Thank you for being with us.
Well organized. Thank you very much for your support. You've been very nice
टिप्पू कहाँ पे बैठी?
You'll be provided with both pins and everything, and you'll have to just there will be numbers on each of the posters, on the board. Putting your presentation poster on the same board. Yes, that's your wish how you want to present your poster. That's how will that work.
ఫస్ట్ చైర్లన్నీ మోడిఫికేషన్ అంతే. చైర్ల ఇట్లే అలా
That is the thing. And
that is the challenge.
Like I always said twice, I said that it's basically the soil and plant texture.
This is so tomorrow what is the
Anywhere in the world.
Good morning. You might see the day also. అన్న రేపు ఇందులో
Straight.
If the third repair would have been good. But as
సార్ ఇది ఒక హాల్లో స్టేజ్ మైక్ రేపు ఓన్లీ ఒక దగ్గర అదే అసలు వాళ్ళు స్టేజ్ బ్యాక్డ్రాప్ మూడు ఇవన్నీ తీసేస్తాను. నేను చెప్పేసిన ఆల్రెడీ. అవునవును, ఏది మన దానికి బిల్లు మీద పెట్టేసేయండి. వైన్ డిన్నర్ అని పెట్టేసి మన క్రిస్మస్ ట్రీ ఫెస్టివల్ అని పెట్టండి. అది యాక్చువల్లీ నేను ఆర్టికే లేదు సార్. అది ఎవరు శాంతన మీరైతే బిల్ పంపించండి. నేను బిల్ పంపించి నాకు ఇప్పుడే బిల్ మీద క్రిస్మస్ ట్రీ లైట్. ఒరే ఎంతసేపు రా? ఎంతసేపు? ఇక టొకటో కావాలని మీరు ఇంకా నెంబర్ చేస్తే ఎట్లా? 6 టేబుల్ నీకా? 2:30 అనుకుంటా.
మళ్ళీ స్టార్ట్ అయిపోయింది. ఇప్పుడే అయిపోయింది. 45 minutes అంతా.
ఆడ నీ కూపన్లు ఇచ్చిన ఎవడన్నాడు ఆల్రెడీ ఇచ్చేసిన ఆల్రెడీ. ఇది ఒకటి దిశ ఇది దిశ ఇది దిశ అవుతుంది ఈ దిశలో పెట్టు జర్నలిస్ట్ అని చెప్పా రెండు తీసుకు అంత తొందరగా Right. Only go to it. అన్నాక నేను మధ్యలో పోస్ట్ నోట్స్ పెట్టుకుంటారు పెట్టేసుకున్నాను వాళ్ళు పెట్టి అది అక్కడ పెట్టి చైర్ తీసి అందులో లాస్ట్ లెఫ్ట్ సైడ్ 2 rows వేసాను అందులో ఏమంటారా 2 rows చైర్స్ వేసి మిగతా తీసాను సరే ఇవి కూడా ఫస్ట్ చైర్ తీసాను అందులో ఈ చైర్లు తీసుకువేసి ఆ లాస్ట్ రో ఇప్పుడు తీసుకెళ్ళిన అవ్వదు నేను ఒక 10 చైర్లు పెడతాను 10 చైర్లు పెట్టి అక్కడ మనకి ఒకసారి ఇంకా పోస్టులు వేస్తే అది చివరి 4 3 ఇచ్చేది. पहले इधर लगाओ, पहले इधर लगाओ। उठाओ, पीछे से उठाओ। नहीं ये खुद अच्छा इन्होंने बुक किसको लिखी है बताना ना स्टैटिस्टिक्स से बायो स्टैटिस्टिक्स से बुक लिखी है उनकी बुक दोनों मिलकर साथ में लिखेंगे इनका स्टॉक इसी का है देख रहे हो देखे वहाँ पे हमारा अरे तुम लोग अलीगढ़ वाले तो वैसे कहीं भी जाने लायक नहीं है ना लोग दिल तो हमें तोड़ा है दिल तो तभी टूटिया दो वर्ड सुनने दिल टूट गया मेरा मजा हुआ दो कुछ भी सुन उनकी मोहब्बत है अलीगढ़ वाले कहाँ जाने लायक है जाओ अकेले तो मिलने जा रहे हैं ना तो जा रहा हूँ क्या
కాన్ఫరెన్స్ అయిపోయింది సార్. ప్రైజ్ కూడా ఏ ప్రైజ్ ఉన్నాయి వాళ్ళందరిలో ప్రైజ్ కాదు, మార్క్స్ ఇచ్చారు. బాగా మాట్లాడుతున్నారు. లైట్ తీసుకో. ఈ లైట్ ఆ లైట్ అక్కడి నుంచి కొన్నాడు పెట్టుకొని చూస్తున్నాయి. చూడతలా ఫస్ట్ ఏంద్రా అది, నువ్వు వచ్చావని షేక్, నేను వచ్చానని షేక్ అయినాడు. ఈ లైట్లు 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 మార్చు ఫస్ట్. ఇక్కడి నుంచా అక్కడి నుంచి రా నాయన, అవతల నుంచి. ఎక్కడి నుంచి పెడతారు వాళ్ళు? అక్కడి నుంచి కదా, అక్కడే కదా. జరుగు. ఫేసింగ్ ఇదే కదా, రెండు సైడ్లు పెట్టుకో. ఇక్కడ కూడా ఇంకో రో వస్తుంది. ఓహో, ఫ్లోర్ లైట్లు కూడా ఓకే. ఫ్లోర్ లైట్లు కూడా ఆన్ చేయాలి. ఆన్ చేయాలి. ఫ్లోర్ లైట్లు ఉన్నాయి కాబట్టి సెంటర్లో ఇక్కడ ఒకటి అక్కడ ఒకటి. ఏంద్రా ప్రైస్ పెట్టి డైరెక్ట్ వేసేస్తే అంతే. ప్రైస్ పెట్టి ఉందా? ఒకటే ఒకటే ఒకటే. ఫస్ట్ ఫ్లోర్ లైట్లు అన్నీ ఆన్ చేసి అన్నీ ఆన్లోనే ఉన్నాయి. అంతేనా? ఇంక్రీజ్ అవుతాయి. రైట్ చేసి మొత్తం లైట్ మీరే ఉంటారు. ఎక్కడైతే క్రౌడ్ ఉంటున్నారో అదే కావచ్చు. క్రౌడ్ ఉంటుంది. క్రౌడ్ ఎక్కడైతే వస్తుంది దాంట్లో చెప్పండి. బ్యాక్ ఆడియన్స్ అనుకోండి, అది కవర్ చేయదు. కవర్ చేయాలి. ఆడియన్స్ ఉంటే మాత్రం కవర్ చేయాలి. ఫుల్ అయిపోయారనుకో కవర్ చేయమని చెప్పండి. అవతల ఆడియన్స్ కవర్ చేయాలి. ఆడియన్స్ ఉంటేనే చేయాలి. ఎక్కడ అవతల ఉంటేనే చేయాలి. ఆడియన్స్ అట్లా కవర్ చెప్తారా? ఇక్కడ ఒకటి పెట్టుకొని చెప్తారా? అంతేనా? అవి ఎక్కడ ఫస్ట్ చూసుకొని చాలా ఏదన్నా సీరియస్గా ఉంటుంది సీరియస్ చేయాలనిపిస్తుంది నేను కొట్టాలనిపిస్తుంది కొట్టాలి మరి ఏం చేయాలనిపిస్తుందా గణేశనా
Madam, yes. Wait a minute. Okay. Okay. Over.
Can we have now Dr. K.S. Sanjyoti?
Madam, come in the middle. Middle. That's it.
మధ్యలోనే ఏంటంటే షోల్డర్ మీద పెట్టుకో, అది చూసుకో. సన్నగా పెట్టేసి ఏం కాదు ఇప్పుడు, రెండు సన్నలు పెట్టేసి మొత్తం
డైరెక్ట్ కొట్టి
అది కూడా పైకి బౌన్స్ చేసేసాను.
అక్కడ టేప్ ఫ్లోర్ లైట్లో
ఓకే, ఫ్లోర్ లైట్లు కూడా బ్రైట్ పెట్టేసి, ఎందుకంటే ఫోటో ఎగ్జిబిషన్ కదా, సో బ్రైట్ లైట్ మొత్తం పెట్టేసాను.
సౌండ్ తీసేసారంట. ఇప్పుడు డిస్క్రైబ్ చేయరా మరి?
వాళ్ళ ఎగ్జిబిషన్ అంత మాట ఇట్లాంటి
మీ ప్లాంట్ ఎగ్జిబిషన్ ఎందుకు ఎవరల్లా వర్క్ మూవీ స్టైల్ కదా
ఇదే కదా. కొన్ని ప్రతి పోస్టర్ అంటిస్తారు కదా, ఆ పోస్టర్ ప్రతిదీ డీటెయిల్ చేయాలి. ప్రతి పోస్టర్ డీటెయిల్
తర్వాత ఇలా పడేసి కొంచెంసేపు,
తర్వాత కాసేపు షోల్డర్ మీద కాసేపు పెట్టుకుంటే కాసేపు క్లోజ్ వస్తూ ఉంటాం మధ్యలో చూస్తాం.
ఆయన షోల్డర్ వేసుకొని ఒక పోస్ట్ అంటిస్తారంట. అవును, అయితే దాన్ని షోల్డర్ వేసుకొని క్లోజ్ చేయమన్నారు చెప్పండి. అవును మరా ఇదేనా ఈ లైట్ ఏమో క్లీన్కి
కేబుల్
I would request all the attendees to please stick your posters on the notice board. First poster session will start from P01 to P24. And it will start at 15 and it will end by 16.
तो मैं लगाता हूँ आप इसमें डालते हैं
इसमें कलर्ड पोस्टर बनाना शुरू कर दिए बच्चे।
मैं बाहर हूँ, तो मैं ज़रा मतलब घर जाता हूँ तो उनसे बात करता हूँ। तो अच्छा ठीक है, ठीक है, हाँ हाँ ठीक है, कर दीजिए हाँ जी
అంతేనా టేబుల్ చేస్తే వచ్చింది
हाँ जी ठीक है, लेकिन मेरे को फ़ोन करके बोल देना। हाँ हाँ जी, हाँ यही नंबर ठीक है ना। लेकिन बात सुनो, आप मैं कल नहीं
अपने कुछ लोगों ने अपने एडवर्टाइजिंग पर्पज से उसमें వాడతాను చెప్పాలి ఏం అడగదండి మీరు ఫస్ట్ మీరే
Yeah.
Hello. A small announcement to all of you. Those who have their poster numbers from 1 to 25 are requested to put on their posters because this poster session will be evaluated in some time. Judges are on their way. And I request those who have posters from poster number 25 to 30, their poster sessions will be after this session, and I request them to sit in a 01 to attend the session. We have yet not received poster number 2, poster number 3, and poster number 4. I request those who have posters 2, 3, and 4, and 16, 15, please kindly put on your posters because judges will be coming to evaluate. I request if you have friends who have posters from 2, 3, 4, 15, and 16, please ask them to put up their posters. Those who have posters from 25 to 30, they will be evaluated after 4 o'clock. Please attend the session in 01.
अपना जो दिल्ली से शमशाद साहब शमशाद उन्होंने ये एजेंसी
उसका हॉल है
आपके पास कहाँ से हमारे यहाँ वही खालिद साहब दिल्ली में लगभग कैसे भेजे उनको ये पैसे दे देते हैं, पूरा एग्जीक्यूशन भी लगाते हैं। बस बस
like in Ayurveda, Panchveda Kashaya Kalpana, which are told. Like that, in Arka Prakasha, Dravya Kalpana have been told. 5 Dravya Kalpana. Like Skalka, Rasa, Churna, Taila, and Arka. And Arka is best among them. So Churna means these Kalpana are according to the Panchabhautika. Means Parthiva Dravya are to be considered and taken for Churna Kalpana. Prithvi Jala Mahabhuta Pradhan Kalka Kalpana. In that way, it has to be taken. And Arka is meant for Vayu Akash Pradhan. And again, what they have, that's what I'll tell you. According to this Panchamah means if we consider Bhutantaram Pravesh, first is Akasha, then one Mahabhuta goes on side. So what happens in it is, if we consider this theory and consider any Mahabhuta Dravya, Vayu and Akasha is there in every Mahabhuta. May it be Prithvi, may it be Agni Pradhana, may it be Jala Pradhana. Vayu and Akash is there in every Mahabhuta. So, may it be any Mahabhuta Pradhan Dravya, we can take out Arka Pradhan. Because Vayu and Akash is there in every Dravya. That way it is, yes, definitely it is possible. I think means I've been taking out Arkas from some series. And we can take in Dravyas which can be used for Arka preparation. Katyanya, according to Katyanya, there is divided in types like Atyanta Katyana, Katyana, Ardra and Pallava. And which of these can be used like seeds, fruits, flowers, leaves, nuts, rhizomes, and different types of leaves of it, Vileshaya, Prakash and Ram. So for them, different methodologies are there. Actually, Purva Karma for preparation of Arka are different. According to the Purva Karma, the procedure differs. Differs from Dravya to Dravya.
So basically,
Yeah, definitely. It means for preparation of a Dravya to extract Arka, there is a different procedure. Means if we are taking mouse to extract Arka from, the procedure is different. Yes. But procedure means the Purva Karma. But the Pradhan Karma is the same. Except for this Agni. Different types of Agnis have been used. Like Dhumagni, Deeptagni, Mandagni, Bhatagni. So according to Katyanya, that differs. And with that consideration, the procedure has to be. And
therapeutic usage of Arka.
therapeutic usage means in Arka Prakash it is said that there is no disease on which cannot be cured. Every disease can be cured with Arka if it is used wisely.
So you mean to say this is substitute for all the Ayurveda?
Definitely, if used properly.
And what is it? Time of expiring?
Actually, that's shelf life. They have explained it as means there's no much explanation about it, but I still have few arkas with me which I had prepared about 5 years back, so still good in quality, and I'm using them. There's no reference.
As the time goes on, it increases or it decreases.
For Arka, there is no reference regarding saying that as the time passes, the potency increases or decreases. But I think the potency may stay the same. Yeah, that's the myth saying that only volatile contents are means the drugs with volatile contents are supposed to be used for Arka. It's nothing like that. In Arka Prakash, he has said that if you use the method properly, you can take out Arka from your stool. No, not at all. One more thing about this is that the content unknown after extraction of Arka, the remnant can be used. Like when we add water in it, it has to be
వాళ్ళ దగ్గర ఉంది కాపీకి ఇచ్చాను కదా తీసుకురావాలి మధ్యలో కూడా వెళ్తుంది 13 minutes స్టార్ట్ అయినప్పుడు జడ్జెస్
रेफरेंस की और वर्क का इनोवेशन रावण ऐसा भी पहले भी था
చెప్పు నేను తీసుకురా చెప్పు
I request all the attendees to be nearer to the presentation because judges are there and they are looking at your presentation. If there is nobody to present, you won't be scored on presentation. So please be there near your posters. I request all the poster presentees to be nearer to their presentations, nearer to their posters, because judges are coming to evaluate. Do we have poster number 23 here?
జడ్జెస్ వచ్చినారా అసలు పట్టుకో చెప్పు ఇప్పుడే చెప్పు కాపీ అయిపోయిందంట తీసుకురావాలి బ్యాటరీ కూడా వచ్చినారా జడ్జెస్లు వచ్చినారా అంటే రెండు చేతులు సరిపోతాయి. జడ్జెస్ వచ్చినారా లేదా తెలియట్లేదండి. జడ్జెస్ సరే
It's an epidemiological poster. It's not really a research poster. This is epidemiology. There's no actual research.
What she's trying to say is that this is just a study. You haven't done really a research. You're just posting a study.
You've sort of you're posting. You've compiled information, and you're just presenting the information that you've compiled. There's no actual
Research it.
Right.
So what she's trying to say is it's like compile the study from internet and books and study.
Internet, Wikipedia, research.
Okay. The poster is beautiful.
Thank you, ma'am.
The layout is excellent. The language is beautiful. There's only one thing that's missing, okay, which is that if you were going to talk about malnutrition in India, then it would have helped your presentation if you could actually show something that you did, to determine causes of malnutrition, maybe in the area where you live, or if you were to go out and talk to some people, interview some people, or get a certain number of subject patients, you understand? That you could say, okay, we looked at.
Excuse me, ma'am. We are second year students. That's why we don't have that much knowledge. But we're trying to like, present this poster.
Right. I know that. And what I'm encourage you to take initiative. Okay? To take initiative means not just to go and read books or get information from the internet, but for you to actually yourself discover some information. So, for example, when you talk about even if you talk about water supply, okay, or fruits and vegetables, then you could talk about, take a certain area and look at the water supply in that area and what problems do the people who live in that area deal with, in order to bring it to life. So it's not just an isolated, arbitrary piece of information. You want to actually see how this affects real people.
We note this point next time.
Right. So next time you will do that. Okay? All right. But
Thank you.
This is a really pretty.
No, 22.
Yeah, this is 22, right? So I suppose I'm supposed to write it here?
No, it's fine.
Yeah, it's fine.
You do not speak
You're from Cuba?
Only.
Nice to meet you.
Now we were reading the old posters. All the posters are from India. I said, because I went for the regulatory agency, like FDA, USA. And I prepared this about pharmacogenetic and herbal medicine and this about regulatory status. Today I gave a conference about
What are the challenges of pharmacogenomics in Cuba?
In Cuba, it is not only in Cuba, it's around the world because pharmacogenomics is a relative new science in infant, and the people are not related with the data.
Do we have poster number 27 over here? Do we have Mr. Gaurav Soni here?
Metabolizing and the you can also use the dose, specific dose of the drug or herbal medicine. And I want to reflect with this work. The herbal medicine has the same pathway as the conventional medicine. Can be regulated, can be
अरे मग सर एक टेस्ट हमारे बुक
Do we have Harika here, poster number 31? Do we have Harika here, poster number 31?
I was in your conference today. So you did both the 20 and 21.
Red t-shirt ఉంటుంది. ఇది అటు సైడ్ ఉంటుంది.
Does this always just if a person is having a migraine and they receive this nasal therapy, does it make the migraine go?
Yeah,
always. Does it work always? Always. But do you have sometimes situation where patients migraine does not work? 100% of it.
Depending on the severity. It varies from patient to patient.
That's, you should have put that in there. See, because when you're this poster would be considered advertising. It would not be considered an unbiased you have to show so you can say that this is the probable mode of action. That's what you believe is the mode of action. You don't know for sure. And it would also help, it would have helped your poster from a scientific point of view if you were to be able to show that, okay, we have we know that if we have the patient measure the severity of their migraine on a scale of 1 to 10, okay, using these then you can say if the severe migraine is if the patient adds up all these symptoms to maybe a score of and moderate migraine if the patient has a score of 15. And then you can say those patients that had a score of 20, if they did this nasal treatment, how quickly did it work? Or how quickly does it work? And how well does it work? And if the patient has a score of, say, 5, does it work more quickly? Then that gives your poster a scientific. Do you understand what I'm trying to say? Yeah? Otherwise this poster would be just simply it's the kind of poster that you would use if you're a drug company and you're trying to sell your drug. And you're just advertising it. Does that make sense what I just said? I'm here to give you criticism, right? So you learn because when part of the learning process for all of us who are
First year PG, I didn't done any clinical trials.
All right. So, but you don't even have to do clinical trials as much as you have to design it. You have to think of it yourself. Like, okay, how do doctors determine, the severity of the migraine? And does this work based on the severity of the migraine or the duration of the migraine? These are the things that you have to I hope I'm not annoying anybody, right? This whole exercise is for you to learn, right? So you do things a little bit differently, right? So I hope you take it. Huh? Right? Okay.
यहाँ लगा खाली जगह में एक्सप्रेशन नहीं
This is yours? Very good. Just one thing. Could you elaborate on this?
Yes, ma'am. These are the markers to be used for the DNA fingerprint techniques. These techniques are used only for the authentication of the plant herb.
Okay, I understand all that.
Yes, ma'am.
I want you to just concentrate on this, application and disadvantage.
Rapid RPD marker. This full form is the randomly amplified polymeric DNA. Application is genetic variations. The plants are different. That plants are different type of genomics DNA fingerprint. These are but these marker disadvantages are not reproducible. One best vary to another component. And another marker is SCAR, sequence characterized amplified region. These are basically only used for the authentication of the herb, but they're available for the limited number of the herbs. Some herbs are available in these countries, other countries. Third is ISSR, intersimple sequence repeat. These is the DNA fingerprinting and the clonal variations, monoclonal variations like that. This and the dominant marker is disadvantage.
Okay, that's fine. Okay, the reason I asked you that was because I wanted to be sure that you understood what this was, what you wrote. When you write something, it's your responsibility to try to read more about it to understand what it is.
The review.
So the disadvantage of doing the ISSR is that you can only discover the dominant markers and you won't be able to discover the minor markers, which differentiates.
And constantly worried about that one factor. आपकी बॉडी में एक सिंपल सी चीज़ है सिंपैथेटिक नर्वस सिस्टम जिस चीज़ के बारे में आप ज़्यादा सोचोगे वो चीज़ ऑटोमेटिकली बढ़ाता जाता है So if you're worried about your blood glucose level, it is stimulating inaction of insulin, number one. Number two, it is promoting hepatocytic glucose conversion to glucose back into the blood. So that is why it's right now. It's a lot.
But you actually kind of go one step farther just to understand what it is in your.
So it's about it has like body science, it has to be developed. The people who are learning it need to know it properly. So they need to be taught in that way. So it is regarding the teaching and learning methodology. The ancient method of teaching was like Guru and Shishya.
You labeled it as number 5. 5 is Ark and
Shall I start with 5?
So both are yours?
Yes.
Okay. Fine, you just go ahead. Then I'm not confusing, I can put it anyway.
Right. So Shishya used to ask questions and Guru would answer them. So it was basically student oriented. According to his interest, the things used to be taught.
That has to be the way it has to be. Right.
But these days what happens is the different thing. Students are sitting and teachers come, they explain as per their mind. So it wasn't there. So it was for the involvement of the students in the subject and even to ensure that eligible student gets the knowledge. Right. So same is means reflected in the text also.
It is
somebody means student is asking the question.
Stand very clearly.
Yes, definitely. It's not just about Charaka. All the texts of
all the
are in that form. So how?
But everyone is not.
Except for Ashtanga.
Yeah, Ashtanga is entirely different.
Yeah, that's a Sanghara.
Ashtanga, if you want to correlate it, has to do with lifestyle and hygiene. It has nothing to do with this concept. So that's entirely different.
So what I wanted to say is how Charaka Samhita can be seen as a different structure. Okay. Means if we see first Nidana should come, and not Nidana, Sharira should come, because while teaching first introduction and then the basic concepts of normal, then go to abnormal.
So what you want to say, if I would come down to it in crux, is the 8th sthan that we have.
Yeah, that's
you want to.
No. I'm not trying to say anything in that. I'm saying how this form is correct.
Fine.
Because
that means that you are shifting the place.
No, I'm not shifting that place. Those places. I'm explaining how these places are correct for us.
Okay.
Means how those were arranged. Because why Sutrasthana is the introduction. Once a student has come, he needs to know what exactly is there. Means what is he going to learn. So introduction Sutrasthana. Then comes Nidanasthana. Why Nidanasthana? Because first year student who comes to college, he never asks that what are the linings of stomach. First question he asks is what is gastritis.
Right.
Because he is interested in diseases. He wants to be a doctor and doctor deals with diseases. So he is interested in diseases. His question goes in that.
Right.
So Nidanasthan comes here first so that he comes to know what exactly is there, means according to his interest.
Right.
And that too in such a way that he gets further questions. Even in Guru Shishya Parampara, Guru never explained everything to him at a time. He explained to an extent so that he gets further questions.
Basically, having the curriculum such that it empowers the students' inquisitiveness and allows them to decide what is right for him, so that further specialization becomes easy for him.
Definitely.
Right. Okay, fine. What about this?
This one is about Arka. As even if it is mentioned in text, it is not being used these days. Because one is lack of references and other is the procedures are not known. So in Arka Prakash and Ravana Samhita it has been mentioned. There are only 2 references. Arka Prakash is a part of Ravana Samhita. So in that Dravya Kalpana have been explained. 5 Dravya Kalpana, right? Panchavida Kashaya Kalpana. Dravya Kalpana have been explained. It's Kalka, Rasa, Churna, Taila and Arka. And Arka is said to be the best among these.
The most potent.
The most potent. And these are divided according to the Mahabhautika. And Arka being Vayu and Akash Pradhana, it is the best one and it can be used for anything. Means it's a myth saying that only volatile content
I
drugs.
have a slightly different view here and regarding that. When you say it is Vayu and Akash, it can be used for anything, but at what stage?
Yeah, that's what I'm explaining here. According to Panchabhuta theory, Panchamahabhuta Siddhanta, if we consider Bhutantaranu Pravesha, Akasha is Akasha Mahabhuta, Akasha Vayu is Vayu Mahabhuta, Akasha Vayu Teja is Teja Mahabhuta, and Prithvi is Prithvi Ap Tej Vayu Akash. So, if Parthiva Dravya is there, it is easy to take out Churna of it. If Jaliya Dravya is there, it is easy to make Swaras of it.
I'm not going into pharmacology. What I'm asking is, when you say Vayu and Akash is the most potent, come down to therapeutics, where you're using it. When and where do you use it? What stage of the disease do you use it?
That has to be worked on. Means why?
When you're designing an arc or when you're targeting an arc and when you say it is the most potent form, when do you need the highest potent drug? That is an emergency state.
It's an emergency state, yes.
Most acute state. Right? And why? Because this is Vayu and Akash. And the most acute stage is Bhatmadhan. So to drive it, you need the space to drive it. Thank you.
भेटूया आपण नक्कीच मला जर विचार मला तुम्ही सांगा जास्त
along with the bovine bile, and we have prepared. Yes, we have introduced we have done this preclinical study, but we haven't sacrificed any animal. We want to do the histopathological examination in the next study, and then we can go for clinical trials.
Without. You're doing a new study using Piper nitrogen.
No, we have the standard Unani drug formulation we have taken over here is the bile, Piper nitrous, and Piper longum. We have taken this in 10 gram of Piper nitrum and Piper longum. We have made it in the powder form and mixed with 15 ml of the bile and included in the diet of the almond rats. It forms pellets. So, and we have what we want is that
You're giving Piper nitrum and Piper longum in the like
powdered form.
Powdered
form. Crude powdered form.
Okay. Very good. Very good. I don't have any. Actually, this is except perhaps that say forms which you're giving, but I assume that you're giving it verbally anyway.
చెప్పాలరా నాకు
Actually, I have done some small surgery. I regarding the post surgery. I went to the hospital, so there Shrutika Parichaya, like it is better in that I have done surgery. What looking at this as you said, like it was also only 5 days in the postnatal care. So I am taking a date. What they are using for that, what they are doing for this, basically they are following postnatal. And I just collected the research in that. I got like whatever they are using, what regimen they are doing. And all the things in that also but very similar practices also some medicine in that like postnatal period in 30 subjects told up to the 1 month 3 subjects they are following up to the 1 month, some up to the 1.5 month, some up to the 2 months, some up to the 3 months, and some up to the 5 months. Like this much variations is there. And the day of the birth, after delivery, some having practice the day, it's the day of the delivery, some up to from the first day, second day, and the very strange or some where yeah, finally it's busy. And up to 10 days, they are some like they are not giving bath at all to the post that puerperal babies. And likewise the massage. Actually, they are like 26 people. They are having practice of the massage with different oils like coconut oil, medicated with oregano, whatever for them it is available, and then for congenital and some they are not having practice also like massage and like that is such a good subject and others having the practice, some having up to the 1 month, some up to the 2 months, some up to 3 months, some up to 5 months. Next that's subject up to the minute. And it is likewise the intake of the meat. There's like here in India, some are the vegetarian, some are the non-vegetarian. So the vegetarian family, they are not practicing of the meat at all, but in that same like in vegetarian only. Another having practice, some from the 4th day of the delivery, the 6 days, some of the 12th days and 16 days. In Ayurveda also we have after 1 week only we have to give the meat soup, okay, because this is little heavy, and after delivery the particularly we are not having too much stress to digest that. In that some similar thing modified form of diet. But there is some differences. Like I told that some are not having the practice of the massage, and some are not having practice of that abdominal binder, but it's very actually it's needed. So and these are the drugs which commonly people are using, and it's also mentioned in the certain practices like which they should follow. Like I told, they should at least follow that of Ganga and Nam, they are not following. Why are they not following? Because like there is some parents since generation is coming like that, they are not having practice of that, so that is some reason. By this survey, just I found what some areas are there, so we are educating we just first ask what you are following or not following, some areas are there.
subject matter is simple, but the methodology is original. The idea is original, and the information you have got out of it is something that you can use to bring change. So this is. All right.
Mine is 14.
Okay.
Does it bring about any ion changes also? Any electrolyte changes in the body? Does it bring? It promotes sodium X. Sodium X. That's why it is. No. I don't know.
So coming to results, we have actually first objective of our study is to.
I got it. I went through it.
So first LM 50 milligram per kg body weight. Here the blood pressures have been significantly increased. However, the liver size and liver oxides levels are not.
Okay, when there is lactose intolerance, you cannot give a casein diet. Right? In that case, what will you do? Your drug fails. Lactose intolerance or somebody with a tendency of flatulence and hyperacidity, Gokshur Krit, you cannot give.
But here we have given proof during pregnancy.
Even in a pregnant lady with that predominant metabolic state, you cannot give. Then what happens? And hyperacidity and flatulence are very common abdominal upsets during pregnancy, even for a normal female. Then how would you state? Anyways, you have to give it orally and it has to go to the stomach. How would you use it? Which other form? Basti, would you really give during pregnancy?
But through along with milk,
It can be given in a month.
No, even in the early age it can happen. That depends on the geography.
maybe milk as an will help.
With milk and preferably cold milk. Because warm milk will cause flatulence. आप सोचो कैसे होगा घी तो इमल्सिफाई होगा दूध ऑलरेडी एक इमल्सिफाइड मिक्सचर है डोंट फॉरगेट इट आपने क्लास 12 तक जो बेसिक केमिस्ट्री पढ़ी है उसको ना भूलो दूध तो एक इमल्सिफाइड वो है दूध कोई लिक्विड नहीं है एक इमल्सिफिकेशन है आप सोचो कैसे होगा वो मैं आपको छोड़ रहा हूँ कि वो चीज़ आप सोचो कैसे होगा यस
Here actually what is in all the cases GSD supplementation has reduced significantly.
That I saw. I'm not contradicting your data.
No. I just wanted to ask, but it has induced limb defects actually. So if it is herb drug interaction due to herb
It may not be a herb drug interaction. It may be for any other reason.
because LM is as it is causing pop limb defects and the GSD has increased along with LM it is
So
increased.
then in that case you consider the chemistry.
That's
Consider the chemistry. The other correction or additive instead of milk, I'll tell you, is simply use coriander. Dry coriander powder you can give at early intervals 1 teaspoon with 1 glass of water, no impact. Just one. Who is present out of so many people? The names, please.
Ankita Singh Chakoti and Pallavi Thakur.
How do you define MDRT? If the first line is resistant, you have the second line, third line. Why do you consider the first line as the resistance and call it multi-drug resistant?
So there are different strains of the antibiotic, and the strain that is resistant against second line are called as categorized as XTR, and which is resistant against the third line can be considered as TDR or pantograph.
These are three forms: MDR, XDR, TDR.
MDR is the initial
Right.
stage, and by after this XDR is
Right. I was just clarifying myself whether you know the differences, right or not. Anyways, go ahead.
So here presenting the statistical model based on the bioprospection study. In this, first I go through the biophysiology of the pathogen to select the valent vector so as to select the parameter for the system. And then I go to the classical bioprospection study to select the plants, medicinal plants against this pathogen. And then further from that database, I screen 40 plants on the basis of binary evidence. And then finally I select 5 plants on the basis of mutation.
Okay. What is it? What is the change in the cell wall character of Bacillus tuberculari that leads it to become resistant to rifampicin? When you call it MDR, what is it? What change is it in the cell wall that leads it to become MDR?
As already told that it's quite informative for the many of the drugs, and at the same time again the entry of the
Have you evaluated mycolic acid to be hindering against rifampicin? Then satisfied that any of these or all of these together is enhancing the permeability. You should define the cause for the failure of permeability of the drug. You're talking biotechnology or biochemistry. You should be able to explain it at the level of the cell wall or the cell membrane. The bacterial cell wall is as good as a plant cell wall, so a lot of permeability may be there. Is there any change at the cell membrane level, at the lipoprotein or the phospholipid structure of it?
influx was that again for the drugs that get entered inside the...
Ma'am, you're talking something specialized. It has to be specific. Some pumps are there. There are a lot of pumps in the body. There are ion pumps, there are enzyme pumps, there are inhibitor channels, there are absorption channels. You have to be specific. I mean, bringing out something on the herbal lines is very easy to that extent. But you have to be very clear what you're talking about. I'm sorry, it doesn't have. Fine, fine. Subject है तो क्या करें? कुछ है? I will.
First extract, Puranam Nigram. Oral necrosis.
87 done, 87 लिख दिया and आपका नाम?
Nandakumar. Nandakumar.
Be short, be specific.
The major problem in cancer chemotherapy is oral necrosis. So currently available therapies are very limited.
So we try to develop some traditional medicine. The leaves of like in southern part of Tamil Nadu, it is used in sambar as well as it has been used in chutneys for the treatment of more pulses.
Got it. Let me be just short, fast and specific. Why does oral mucositis happen?
Maybe because of the menstrual problem, or maybe because of the heat in the body, or maybe because of the damage, or maybe due to
Post chemotherapeutic primary cause. So how is it helping?
No, we don't know actually. So we have done with a rat model. We have tried to develop a oral mucositis model for rat. Because there was no currently available models were not satisfactory for rat. So we tried with a blue sulfur and a higher irradiation, so to produce the velocities in the tongue. So we tried to use this extract against this particular model of induction of oral mucositis.
What is it doing exactly?
Which one?
How is it helping even in that model? It brought about changes to the positive side, that's why you reported. How are those changes happening?
Maybe coolant.
So you've not really worked out on the model?
So we actually done with only with this thing. Immunocompromisation we have done with blue sulfur, and we have done with the higher radiation to produce
ఇందానా ఏం చేస్తున్నావు ఎందుకు ఫేమ్ బాటం అని ఓవర్కి అట్లా పెట్టారు
For that, we mentioned there is a
Can you just come down to the
Yes, I have Sir, basically I have done the phytochemical evaluation of my extract. I have chosen the mycelium and the fungal part, and I want to evaluate whether the mycelium or the fungal part or their mixture is better. Which one is better out of the three? And what I have concluded from the phytochemical analysis is that mycelium is the best candidate out of the three. And from HPLC evaluation, when I quantified ascorbic acid being a very good antioxidant, what I found is that again mycelium has more content of it. And after that, I have done the C-square characterization, which is ultra performance convergence.
I got it. So at a high altitude where they have issues because of respiratory issues and factors, how is this? I mean, do you have any models or modes of actions proposed that this is the way it is going to
Sir, actually, yes, sir, actually this is just part of my PhD work. I'm doing bio-guided essay for this Canada studio, and in future I'm planning to do the evaluation But right now I have done this chemical part of it, which is actually
at that level it's fine. Number 4, So what do you want to say here?
Actually, sir, in that small I did survey on 30 subjects from the different regions of the India. In that I found some similarity in their practices.
Done the actual number of apples. So just started out here, and the number here, and the number here. If somebody's just looking at this poster, they don't know, they can't really tell what detail. But
That will be much clearer. Okay, thank you.
I'm moving as fast as I can. Huh? That was very good. How many more to go?
The topic of novel drug Unani formulation, which is preventing cholesterol formation in lab, which is acceptable to
Yes, but let me first read it, and then I can. Okay, now it's clear.
We have shown you the basic thing.
Cage mein baby. That you have to say. तो कोलेस्ट्रॉल you have measured cholesterol कितने दिन बाद
So somebody who at some place who is having 4.5 months somebody having has to do a lot with the local things. It's not culture. It's basically influenced by the environment. That's what becomes culture. So why do you create this? Why create this chart? And this is more of an advice. Just remember, follow that particular climate does not overshadow this That's a suggestion.
Why you are taking
What is the question?
PCOD. Yeah. Tell me. What is PCOD? Why? Why does PCOD happen? Why does that happen? I know that it is polycystic, so it will have more than one cyst. And the first presentation on the surface of the ovary is like a cyst and may be considered a cyst as well. May be considered as a cyst as well. Why does it become polycystic?
Many follicles are.
Why? You're giving me the structural observation of it. I am asking the cause of it.
Because of lifestyle. Proper lifestyle.
If there is ugly manja, how do you associate armpits? And how does insulin come associated with the camera? What is arm? What is arm? Arm is a result of impartial digestion, and that is limited to the stomach and the duodenum. And thereafter it is generating arm fish which is getting into the body, absorbed. How does it relate with insulin? How is arm fish related to insulin? And what does insulin have to do with the liver?
Formation of
How does insulin impact liver? Insulin has no function with the liver, it's extra hepatic. You mixed up modern and Ayurvedic medicine terribly. PCOD is a result of metabolic disorders inducing over-secretion of estrogen at the ovarian level, inducing multiple follicles to mature at the same time, inhibiting the release of a single follicle because enough progesterone is not coming at the same time. That's simple. Current advances in standardization of herbal drugs. Okay, so what do you want to tell me in short? What are the advancements in standardization and what do you mean by standardization?
In short, what is the standardization? Check the
Okay.
This is the standardization. What is the need of standardization? Check the
We know it.
And third, conventional techniques. Good techniques also. Conventional techniques. These are the achievements for the these are simple diagrams used for the evaluation of how it
Okay,
but in this technique, we require master.
Fine, I got your point. I'll put into it. Tell me one thing. This is the crux of your entire thing that will finally define things or your attempt. Plant, and let me take an example, neem. Neem from 10 different places will have 10 different characters. So how will you standardize it?
We are firstly we are using the DNA fingerprint.
Even in DNA fingerprinting, there will be variations.
Firstly, preliminary examination using the microscope to check the external data.
When you talk of standardization, that standard has to be applicable or be 10 feet, 100 species. So if there are 10 different species or there are 100 different species, how will you standardize 10 different DNA fingerprints? That will be information.
Marker to be used for the
technical. You're not telling me the simple thing. आप ऐसा करके करोगे
ऐसा मार्कर जिससे हमारे साथ क्या होता है कि जो भी हम DNA पे उसको मार्कर स्पेसिफिक मार्कर होगा वैरायटी का इंडिकेटर तो वो सर बताएगा कि ये प्रॉपर है या नहीं है, वही स्पीसीज है या नहीं।
आप एक स्पेसिफिक स्पीशीज पे हर्बल ड्रग का स्टैंडर्ड
और सर एक चीज़ ओके सर एक चीज़ ये भी होगी कि कौन कौन से कंपोनेंट्स उसमें प्रेजेंट है ये बता सकते हैं
जनरली सारे
सर ऐसा नहीं है जो कुछ जनरली in the few
see what you can achieve you identify a certain group of genes which will be common to all these people. That is the only level of standardization. That's it.
Over the past 1 year,
Don't go into it. How do you resolve it from I mean, how many types of headache are there? Common headache. Does epilepsy present with a headache?
Yeah.
The most minor form of epilepsy can also present as a headache, and it can be unilateral. How do you differentiate it from migraine? Because both are episodic. Both are episodic, both can be frequent. So how do you differentiate between a very mild form of epilepsy, grade 1, and a migraine? That's my simple question. Differential diagnosis of the two. Migraine or epilepsy. Migraine would usually have a lunar rhythm to it. That is well explained in your text, in my text. Epilepsy will not have any such character. Migraine could be induced by any factor. An epileptic stroke may be induced by a hypersodium ion intake.
Further, I have done HPTLC evaluation.
So why you concentrate in that pharmacy?
Ma'am, because it's just like from
Is there any report on that pharmacy?
Yes, ma'am, it has
Do
shown.
you know that it has antioxidant activity?
Yes, ma'am, it has.
So what novelty in it?
Ma'am, the novelty is that nobody has quantified ascorbic acid in it using the HPTLC technique, and I have done. Nobody has compared the two body parts, which one of them is better. So
Body parts? What are the body parts?
mycelium, which is actually the root part, and the fruiting body, which is the area. So mycelium has given better results. Furthermore, we were earlier using HPLC method in our lab, which took about 30 minutes for its HPLC characterization. But now, after switching to UPC square, which is ultra performance convergence chromatography, what we have found that the runtime has been reduced to 12 minutes. So it's saving your time. Moreover, this
Do you know the cost of this in total?
yes, ma'am, not but since we are working for the soldiers, we have to compromise that for the.
So what benefit soldiers will get?
Ma'am, they will invest them.
Why on Canada? There are so many people, so many things. Why I have to use Canada?
Ma'am, because
Canada is available in higher altitudes? No. Why I will consider? I will go for tomato. The tomato is growing in four seasons. I will go for beet, gajar, all these things where I can grow them where they are staying. Ganoderma you need to grow in a moist place.
Ma'am, absolutely. But it's widely distributed, so we can.
Ganoderma is not good.
Ma'am, it is in South India. Oh, sorry, South India. It is in South India. And
You need a moist place to grow that.
ma'am, but ma'am, the qualities it has, besides being a candidate for antioxidant, it has other properties as well. So besides using it for the soldiers, we can also use it for other benefits as well. Anti-diabetic
Anti-diabetic is going on. Antioxidant, anti-diabetic, what are those? Then this is what is new in your work. Probably it has not done.
This technique is not for any herbal
You have this in your lab? So where you did it?
It's actually something new. Just
What is the यहाँ दिल्ली में ऑफिस में जाके किया? बैंगलोर में जाके किया? What is the so because they will then you will buy it. Huh? So you are working in
Defense Institute of Physiology and Life.
it is funded by DRDO.
But I am a CSIR.
Yeah, I understand from the work. Quality of your work is like that. But try to bring some novelty in the business. You are working in a DRDO institute, so it's a highly funded institute. That's why workers are giving you a whole day to do the work. So you need some novelty in your work.
Actually, Canada well known in Chinese, traditional Chinese medicine. And we are, I don't know about this. No, ma'am, I'm sure it's first time, and I've used this Metabu search database for finding mutated compounds. So I just wanted to explore untargeted
रसायन बड़ी बड़ी चीजें बात करें, छोटी सी चीज की बात करो.
as a part of
It is an antioxidant. Why is an antioxidant a good anti-aging component?
Activity profile. Ma'am, actually, it's just part of my PhD work. In future, I'm bioanalytic essay and evaluated potential of the individual. PC analysis, you take it's done within the audio itself. And just to find out whether the mitochondrial composition of the mycelium to your body are different or not, and we have findings that showing that. We have taken 10 grams of hypermizer and 10 grams of hyperlongum. We have made it in a powder mixed with 15 ml of lye and is mixed with the diet of the rather some of the pellets is orally given to the orally administered.
So it is reducing the total cholesterol and triglycerides.
Yes.
Which component is acting? Is it piper nigrum? Is it piper longum? Or is it the piper?
We have taken a compound formulation.
Agreed. लेकिन आपने उसमें क्या पाया कि कौन सी चीज़ है जो ज़्यादा प्रमोट कर रही है?
The piperin is the main constituents of the piper nigrum and the piper longum, which is having thermogenetic effect and it inhibits the lipogenesis also. So it is.
And what does bile do?
Bile is having taurine, which is an amino acid also, and it's an acid. It's again anti-atherogenic.
Okay. And once this conversion happens, what form is it? HDL to LDL? Triglyceride to LDL? What is the change? What do you propose the action to be? आपने जब evaluate किया तो आपको HDL का डेटा, LDL का डेटा, VLDL का डेटा, TDL का डेटा चारों में था. उसमें वेरिएशन आया. जहाँ पे TDL नीचे आया, TGL नीचे आया, HDL बढ़ा, LDL नीचे हुआ. तो वो किस प्रोसेस में हुआ? उसका कोई मोड ऑफ एक्शन आपने सोचा? वो किस तरह से हुआ? What promoted it?
We have given we have checked the biochemical parameters. We haven't studied the mode of action.
You have not studied.
Yes.
ठीक है, आपके क्लासिकल उसमें कहीं ना कहीं वो मेंशन होगा उनका एक्शन क्या है, या मैं उसके बारे में कुछ सजेस्ट करूँ. मेरे हिसाब से जो हीट की बात आपने की, हीट जनरेशन की बात की, दैट हेल्प्स द चाइल्ड. दो मिनट मैं आपसे अकेले बात करूँगा. पंचकोल का काम और इसका काम दोनों अलग अलग. I got your point. 29. Right?
Thank you so much, sir.
हाँ, अब आप
प्रैक्टिस में भी इसको अप्लाई करूँगा और यहाँ पे मुझे रिसर्च वर्क के लिए अगर इसको कुछ करना है तो मैं करूँगा. मतलब केवल की कितना बढ़ सकता है इसके बारे में हमें प्रैक्टिकल
I request all of you who have posters from 24, please start removing your posters if they have been evaluated by all the three judges. I request all the poster presentees who have posters on the left hand side of the dais to remove their posters, please, if they have been evaluated by all the three judges.
This shows that cisplatin causes damage to the membrane due to which the enzymes take place into the liver. But when we administer the NSO to the cisplatin treated group, the enzymatic activities
I request all of you to start removing your posters if they have been evaluated by all the three judges.
We assay all these enzyme activities in the intestinal homogenates and in the brush water membrane vesicles separately. Then we come to
So, what is the future of the work?
Future of the work is
How long you took to do the study?
This is my 6-month work.
So, what conclusion you take?
I conclude with the study that CP elicited deleterious intestinal toxicity, as it is evident from the increased burn creatinine and cholesterol level. Also, it might be due to the antioxidant mechanism. Cisplatin disturbs the antioxidant system inside the body, inside the intestine, and we also say that NSO administration, it brings the values to the control level. It means that NSO is somewhat decreasing the toxic effect.
How did you prepare NSO?
We take it from the Hamdard that is available in the market, Nigella sativa oil.
So, why do you call it NSO oil?
We take Nigella sativa oil. There are also Nigella sativa express and Nigella sativa seed.
तो इसके आगे कैसे बढ़ना है, क्या करना है?
आगे ये करना है कि जो नाइजीला सटाया है बेसिकली उसके सीड्स में और कौन कौन सी कॉन्स्टिट्यूएंट्स हैं, लाइक फाइटोकेमिकल कॉन्स्टिट्यूएंट्स है, हाइमोक्विनोन, हाइड्रोक्विनोन, ये डिफरेंट
तो ऑयल का क्या फाइटोकेमिस्ट्री तुमने किया, वो ऑयल में क्या क्या है?
ऑयल में भी हाइमोक्विनोन है, लेकिन उसमें एक्सट्रैक्ट में डिफरेंट प्रोपोर्शन है हाइमोक्विनोन का, और एसेंशियल फैटी एसिड, ओमेगा 6 ओमेगा 3 फैटी एसिड जो है उनका अलग अलग परसेंटेज है, तो हम उनकी अलग अलग परसेंटेज लेंगे, फिर कंपेरेटिव स्टडी करेंगे.
ఇంకా ఎంతమంది
along with copper. Basic idea is in the present. Along
उसके बाद इंस्ट्रूमेंट का मेथड लिखना चाहिए. एंटोन रिएक्शन है का, you have to say this word. It is what कमेंट ऐसे कैसे? उसका प्रिंसिपल बताओ क्या होता है, why we are saying this
compound 5 seconds on human lymphocyte and prove that there is a DNA breakage along when we are using it with certain concentration of copper. When we have used this is control, there is no damage. This is 200 micrometers 5 seconds alone, not without copper. A little bit of damage. C. So this is 200 micrometers highest concentration with 50 micrometers concentration of copper. So it is.
We have question number 28.
We are trying to show here
So all the copper is getting the rest.
30, question number 30.
Delete कर लेता है तो उसमें इतना डैमेज नहीं होता है.
तो क्या इसका करने का objective क्या है?
We have question number 30.
Why you want to take?
We have already got positive results in vitro and rat models. I have not shown it here.
So from where you
Do we have question number 30?
Source, you want to know the source?
Gulab Rai Devani.
I have brought it from Sigma. Actually, the source is various different vegetables and fruits like red wine
Is it
and
now you
grapes.
bought from season and then you tried it here? So did you purify that? How many bands have you seen that in Pisatin? How many bands of single band or something? Pisatin को तो purify करके देखना चाहिए.
Question number 31. Harika.
There is already mentioned that it is a 99.8%.
Okay, I will give you a Sigma product and then you will run it in the gel or in column or as a protein, you run it in column and then tell me. You are from Aligarh, so one of the best institute in India. So इसको तो purify करके देखना चाहिए.
Question number 33. Joby Abraham.
When I went abroad, my professor first asked me to purify the tyrosine.
We have Joby Abraham.
And I got so many bands of tyrosine. That is 99% pure of Sigma product. So that's why I'm giving you the hints.
Question number
Claiming
33.
Sigma 99%. If you want to do good work, okay, देखना पड़ेगा whether it has. You can identify it. So what is your future plan of
Ma'am, we are
Question number 35.
a rat model.
K. Rudarma Devi.
Taken few results have shown positive.
you have the right infrastructure? You have the
Rat data, ma'am.
You have already started the work on that?
Right.
You want to see it in vivo model, whether it is working or not?
It is working.
It is, you did it in your lab? Or
Yes, ma'am, in my lab.
बताओ क्या किया?
Question number 37.
Problems in relation to depression and how to manage these cases like that.
Who did the work? No, Excel. All three of them. So, why you did this? Why do you choose this?
Day by day, diabetes is increasing worldwide and it needs awareness about this, how to deal with diabetic patients, their family problems and how to counsel them, how to manage their day-to-day life. So we have chosen this.
इसके बाद क्या करना है?
Ma'am,
What you got from what is your company?
Ma'am, we are going to spread awareness in homeopathy books बनाएंगे एज के भी जिनमें 30 पेज 40 के एज में ज़्यादा दिख रहे हैं ना केसेस, तो वो अवेयरनेस स्प्रेड करने के लिए कुछ करेंगे, काउंसलिंग, साइकोथेरेपी यूज़ करेंगे, कॉग्निटिव बिहेवियरल थेरेपी यूज़ करेंगे। थैंक यू मैम।
उसका क्या नाम है? मेरे से Why?
Live. My work is on structure of Charak Samhita and how it can be beneficial for development of Ayurveda in teaching and learning methodology. Like science can be science can develop if the students are learning it properly. So in that way, I worked on the structure of Charaka Samhita and how it can be helpful in teaching methodology. So if you see the ancient method, it was Guru Shishya Parampara. And it was more of Shishya oriented, means student oriented. Ask question to Guru and Guru would answer. That too in a certain extent, so that he'll get next question further. He will never explain to the fullest. A topic which is taken, he will never explain fully to an extent, so that he'll get further questions and he'll answer that question. Same pattern can be seen in text source. Means the texts are also in the same way. Like the student is asking the question. Teacher is explaining that, means explaining it from the past. So if you see the text, we see that Charak Samhita, there it means one and so if we see the sequence, Sutra is introduction.
No, I understand, but
Syllabus sequence means why I took this means introduction. How would introduction means if we see this first, I'll tell you this. Means it is like introduction. First is introduction.
why you did this one?
So that the teaching methodology could be changed. It should be more of student oriented. It shouldn't be like teacher oriented. Because what happens is teacher comes, he starts explaining whatever he wants. Students sit, they take out notes, and what they understand cannot be justified. And in this method, there is insurance that eligible student gets knowledge. Means the one who is interested in it, he asks the question.
But that is not happening now.
It's not happening now. And if I just say that it should happen, it won't be having anywhere. So means I search for it in the text, in the form of reference, so that there could be some awareness regarding the teaching method. So the way it is, if we see this, Sharirasthana is structured, and in first year what we learn is anatomy physiology. So first it should be here. After introduction, anatomy physiology should be here in the second place. But it's not like that. That is diseases and diagnosis. Why? Is because the first year student. No. It is in Charak Samhita. It is like that. Why? Is because a student of first year never asks what is the size of stomach, what is the capacity, what are the linings of stomach. What he asks is what is gastritis, because he is interested in diseases. It's his interest. According to that, there is explanation. So there is Nidanasthana, and they don't explain everything in Nidanasthana. They explain it to an extent, and he gets further questions. Like if we say that it is inflammation of gastric mucus, they say what is gastric mucus. So the disease factors. That's Nidanasthana. Next to Nidanasthana.
You are a student? Which year?
Second year. This one is also mine. This one is Arka. It's physical like preparation of it's method of preparation of classes. It's in Arka Prakasha Ramasana. It has been mentioned. But these days nobody is using this because there are very there's only one reference, Ravan Samhita. And a part of Ravan Samhita is Acupuncture. Only one reference in Ayurveda. And people don't know the procedures also. So I went through the Ravan Samhita and saw what exactly they mentioned. They mentioned five Dravya kalpas. There's 5 methods of preparation of kalpa. So
That is not following now.
this is not being followed, especially this one. These two are being followed. Churma, kalpa, rasa, taila, but preparation of this is not known. And this is supposed to be the most important one among these. If you consider the Churma part of the so Akash, how Mahabharata has gone, they have explained it like Akash is first. Akash and Vayu combined for Vayu Mahabharata. Akash, Vayu, Teja for Agni Mahabharata. Akash, Vayu, Agni, Jala for Jala Mahabharata. So Agni Mahabharata has got all 5. And if you see these Kalpana, Churma is meant for Agni Mahabharata. If we see that way,
This is, you are suggesting that it has to be followed.
yeah, this is the best.
So now madam, you have more.
One more is not problem there. This is number 6, but it's number 5.
Number 6. Question number 6.
Yeah, this one is question number 6.
That is?
That's question 5. But in the list, this one is mentioned as 5, that is 6.
Okay, that's no. Yeah.
Essential oil का प्रॉब्लम लेवल कम होगा
कोई लिटरेचर में नहीं है.
इंडिविजुअल सेकेंडरी मेटाबॉलाइट्स का बहुत कम हुआ है. पूरा एमएलए का किया होता अगर एसेंशियल ऑयल सेपरेट करके इसका हॉस्पिटल से
इसके क्या पहला रिपोर्ट का फर्स्ट रिपोर्ट.
Yes.
You are confident?
Yeah, I am confident.
So why you are intuitive?
Basically, I am constructing secondary metabolites, individual secondary metabolites. Second, you have primary metabolites and secondary metabolites are primary metabolites.
Give an example.
Alkaloids.
So you have selected the wild form. You did the TCMS. You have TCMS in your. You have TCMS? Or you did it from somewhere else?
No, I did it from
Chinrara.
सन और मून की रिजल्ट एक साथ से नहीं ना हो सकती ना हो सकती. So instead of trying to follow it as it is in the text, is it not better advice to modulate the cycle as per your life? अगर आप अपनी ज़िंदगी की ज़रूरत के हिसाब से उस साइकिल को मॉड्यूलेट करें, उस जैकेट में बंद ना होके, तो क्या आप इस गोल को अचीव नहीं कर सकते? Try doing it as a practice, you will get your results. Thank you. 28. How are you stimulating the vestibular? By swing. By swing. Swing of what? Yeah. Swing. That is our tradition actually. So actually in foreign countries, so they are doing vestibular stimulation by using a very big apparatus which costs us 40 to 50 lakhs. Purchasing that instrument.
In that knowledge.
ఇప్పుడు ఈ బ్యాచ్ మళ్ళీ ముగ్గురిని మొత్తం ఫాలో చేయాలి. ఒక ఆయన ఇంకా ఇద్దరు అక్కడ కంప్లీట్ అవ్వాలి. కంప్లీట్ అవ్వాలి మళ్ళీ తిరిగి
So what does it do? Does it stimulate the hypothalamus for something?
See, this vestibular stimulation, vestibular system is connected, very well connected with hypothalamus. The thing is that if you stimulate, overstimulate vestibular system, it will stimulate hypothalamus. But if you do controlled vestibular stimulation, that inhibits the hypothalamus. So it inhibits HPA pathway, hypothalamic pituitary axis, and decreases the cortisol level. That is first way. Second way, it stimulates hippocampal formation. Hippocampal formation will inhibit the hypothalamus. Third way, it increases GABA level, gamma aminobutyric acid, which inhibit HPA axis. So all these ways, it is inhibiting your stress axis. So it is relieving you from the stress.
So it has to be a regulated swing, right?
Yes, but problem is that no one has defined so far what is controlled vestibular stimulation. So for the first time, we are going to publish in February. It is getting ready. We are giving definition for the controlled vestibular stimulation. Say, if you want to prepare Indian version of that instrument, what you are saying, regulatory swing. If you go to company, if you order them, you prepare, immediately they will ask what frequency it should move, what direction it will move, what intensity it should move. How you can establish that? We are doing it by swing. We have already doing that. We have established the swing in our institute, and we are doing it in college students. We will make them to sit on the swing, and we are telling them, you take your own time. You swing how much time you want. You swing how much fast you want. You swing how much intensity you want. They will do it. We are taking the mean values of it. Then we are defining this is controlled vestibular.
Just going out of this, since you're talking of a metabolic disorder, can this also be helped at a different frequency level to manage a condition like thyroid?
100%. Because I have presented my oral presentation, that is vestibular modulation of endocrines. It is not acting only insulin. It is regulating almost all the endocrines. Because first thing, it is stimulating vagus nerve. Vagal stimulation will increase almost all the endocrines. That is a known fact. Then it is acting on hypothalamus. Hypothalamic regulation, we know that it is regulating most of the hormones. Even it is regulating your circadian rhythm, because it is very well connected with suprachiasmatic nucleus, and it is regulating release of serotonin.
Fine, so, I got your point. Thank you. Okay, this is also yours. And the same concept.
Another application of it.
I can get it. Perfect. Not an issue.
అరే అటు సైడ్ వెళ్ళండి, అటు సైడ్ వెళ్ళండి.
Fine, go ahead. What is the prakriti of venous ulcer? Locally, what is the prakriti of a venous ulcer? How does it present? What is this? This is black. What does that mean? It is Kaphaj. Or Kaphitaj. Or Kapvataj. What is it?
It is a vitiation of Vidusha and Rakta. Actually, Rakta
It is a hypervitiated state where Kaph, Pitta and Vata, all the three are vitiated. Right? So, when you say Jalakavcha, you're going to remove the blood from the local site using
that is vitiated by
leech. You're going to use leech to remove the blood. When you're removing it, what is the first thing happening?
Vitiated blood will be, I mean,
With the vitiated blood, what will come out?
deoxygenated blood will be
Talk in terms of Vata Pitta Kapha. बात आप पहले बात निर्धारण करेंगे, बात कटाएंगे. Rest of the therapy is after that, right?
Do we have poster number 9 here?
There
Do we have Anita Ray?
Yep.
So I'm presenting my small work of my PhD, where we have collected some data regarding the Synaptus paniculotus, because it has become endangered species, and why it has become endangered that we have seen through our data collection.
So you want to tell me that it has become endangered and why it has become endangered? So what is the corroboration with respect to medicine? If it has become endangered, it has gone into the red book, it cannot be used. You cannot work on it if it has gone into the red book because it has no commercial output. If you are saying endangered, that means...
Yeah, it is. But it is not yet in...
Then why are you saying that it is endangered?
It is.
You should say it may be endangered. Right? Okay.
So here we have seen that the Synaptus paniculotus seeds are having oil, which is medicinally important, and this oil is used for different purposes, basically the nervous systems and mental disorders. Similarly, it is also used for different diseases like respiratory diseases of bronchitis, asthma, etc., some digestive diseases, and it is also reported in Ayurveda as a elixir of life, in high traditional medicines, in Unani medicines also. It is reported as it helps in
basically cut paste textual information. What is
data
the
collected.
What data? Where is the data?
It is the review of whatever.
Where is the data, ma'am?
Whatever activities
That is a cut paste. That is a cut paste, right?
Part of the introduction. And then after that, we have done work on the leaves, stem bark.
तो मैम उसका डेटा कहाँ है? मैं स्टेम बार्क में क्या है, लीव्स में क्या है, रूट में क्या है, मैं कैसे मालूम?
It is there, sir. All the uses of the stem.
That we have written.
ये तो टेक्स्ट में भी लिखा है.
But we have carried out pharmacology, phytochemical analysis.
Yeah. Answer queries by thing. So you're basically educating people on homeopathy, right? Okay. So what do you want to tell about it? Why do you say third largest? Why don't you say it is one of the largest? Why are you getting bogged down by anything? So how do you want to do something new to it?
So the distance is no longer
Table. Yours was 37, right? Yes. Perceiving adolescence, the age of emerging problems. Adolescence has emerging problems. It is more to do with basically psychiatric. How do you state it? What is your conclusion? What is the relation between adolescence and any emerging problems? You're talking of a psychiatric manifestation involving some physical manifestation.
The cotton machine, every disease of the
क्यों होता है? आपने जो कहा वो तो मुझे समझ में आ गया. Why? पूरे में कहीं कौन से हार्मोनल You are mixing up physiology with lifestyle.
air to neck.
ये सोशल ये सोशल मेडिसिन का पार्ट है
Machine, authorization machine.
आपका जवाब नहीं 43
This is the cupping therapy and the introduction to the
आप बता रहे थे
sorry. The cupping therapy. I'm just putting the cup on the center part of the body. After 10 minutes, I just move the cups and make the cuts there. Again, I put the cup on the parts. All the wrong material will come on the body. Technically, go only one fish without medicines. Same time, if you have the disease on the kidney, you have to put the cup on the kidney. If you are in the disease on the liver, stomach, I'm just putting the cup on the part of the body. Everything solves out in the
चिकित्सा की तरह 42 It is more of academic. When you say healthcare providers, it becomes more political.
And then also how traditional practitioners, especially in rural areas,
So,
how
you
they are
mean, is it
contributing.
good or is it bad?
Yeah, how far they are playing a
What do
role.
you want to say? Is it
Yeah,
good
yeah,
or is
it's
it bad?
good. It's good. And
good.
yeah, how they are treating the patients and how the patients are like the success rate is also
And this
very
is the
good.
data for Nagaland.
Yeah, actually I've taken from secondary school and in all
I got it. Thank you.
Specifically the dental branch need to more study in dental department.
Be confident. Why are you so bogged down? मैं खा नहीं जाऊँगा. What is gingivitis?
It's inflammation of gingiva. It's called gingivitis.
Why does it happen? What is the cause?